be attending remotely tonight, so I will be chairing the study session. Study sessions are always open to the public to attend in person, or you may choose to listen in and view remotely. Please note that the content of the agenda bills is subject to change. No public comments will be taken and no action anticipated. And the agenda packet was updated at 4 o'clock. Any of the items approved for action by the council tonight will be placed on the September 3rd, 2025 City Council meeting agenda or is otherwise determined. Finally, an ongoing reminder that questions or comments by the public may be submitted on any item at any time by email to city.council@bremertonwad.gov. And Zoom recordings of the study sessions will also be available online within a few days following the meeting. Is
somebody's connected? Yeah, I can't tell. I can tell on my computer. Somebody's connected.
I'm on. Can you guys hear me?
Yeah,
we can hear you, Eric.
Yeah, I'm there.
We're not getting any video though.
So somebody in the room is connected to the TV. So I am trying to figure out who's connected to kick them off. It's LT70070.
Oh, I see.
Yeah, so 1 second.
It's like a murder mystery.
It was up there.
It's probably me.
Yeah, because I got my video on. So the camera's on for me.
Yeah, they put the order on stage.
I feel like there should be a way for you to jump through everything.
Exactly.
Anywhere.
I can't, I used to be able to get approved by calling my phone, but now it's.
So can I move forward with just audio?
Yeah, they've issued new
Okay.
boundaries around how you can sign in.
All right.
Mike,
They
is
can
there,
move, they can show the presentation. I can share.
You should be fine on that.
It's just our screen, what we're seeing, everything else is
So
live.
pretty.
Okay.
I have a quick question about, I can't sign in now. I have to use an authenticator app. Can I use, any other method or can you help me?
Wi-Fi.
Oh, then I won't be able to sign in. So,
Nope.
oh, cool.
Yeah.
Okay.
Okay, we're having an information-only presentation by Salish Behavioral Health Administrative Services Organization. And this is an update. Welcome, Salish. Executive Director Jolene Kron, Kitsap County Substance Abuse and Services Program Supervisor Laura Hyde, and Kitsap Public Health Chronic Disease and Injury Prevention Program Manager Dana Berman, here to present item A1. So I don't believe that the slides that you were going to present were ever uploaded for council. And so this, I think most of us envisioned this more as a question and answer session for, what you're currently doing and what you see you're going to be doing in the near future and then the longer future.
Like an update, I think that's what you were told, wasn't it?
Yeah, so we have a brief presentation about where we're at so far,
Yeah.
and then I think, we have
Okay.
about 10 minutes for a question and answer, kind of where we think we're headed and what our next steps are.
Okay. So did you give a oh,
Yeah.
it's gonna show up here. Okay, we got that working.
While you were talking, you were.
Okay, great.
Thank you.
Make sure. There we go. These are the slides you have been emailed to us. Yes, no.
Have these
Slides been emailed to us?
No, I don't believe so.
Okay.
Yeah.
But a larger package was emailed to Ann on Monday.
Does
All
anybody
the
have
slides came to town on Monday. Okay.
Report?
a lightning
Maybe.
where my authenticator app is?
Okay.
I don't know if I've ever bricked.
We've got a few
That
different
is.
things going
Working.
on here. Go ahead.
Okay. Good evening, my name is Jolene Kron. I'm Executive Director of the Salish Behavioral Health Administrative Services Organization. You did a very good job. Don't keep us stutter on one of those words in that
thank you.
very long name. So very nice job. If we go to the next slide, we're here to talk about opiates, but I'd like to give a little summary reminder of who we are. So Salish BHASO, we are formed through an interlocal agreement between Kitsap, Jefferson, and Fallon counties in the Jamestown Fallon tribe. We are a tri-county entity specializing in behavioral health management oversight across the region. We do have 7 sovereign tribes across our region, and Jamestown Fallon is the primary seat on our executive board. Next slide. So with that, our administrative entity is Kitsap County, and we, being a tri-county entity, we're designated as the Opiate Abatement Council, which is why we are here to discuss that. Our primary book of business is providing behavioral health crisis services, mental health and substance use disorder services for all residents across Kitsap County, regardless of insurance, and then providing uninsured, non-medicated mental health and substance use service funding across also those 3 counties. We administer several special non-Medicaid programs, such as the REAL program, behavioral health housing program as well, again, across all 3 of those counties. Next slide. So the opioid settlement funds update. The state is allocating the funds to local jurisdictions on the regional level, and this being the Olympic region, along with Fallon and Jefferson counties. Per that agreement, there needed to be, there are approved uses for the opioid remediation. We have provided that list in the past. Happy to send that back out to folks if folks are interested. It is a lengthy document. Priority in that is given to the core abatement strategies, and we'll go over those in a little bit. The settlements continue to be negotiated. Just this week, we are looking at some agreements that came through for Purdue and G8, which refers to pharmaceutical suppliers. So this has been a long project with challenges around understanding when and where and how much is coming across all of the entities. But we are getting closer, and as soon as we think we get there, we get more settlements. So we're restructuring our strategies. Next slide. So currently, Kitsap County collaboration of these opiate funds includes a partnership for funding provided directly to Kitsap County, to the city of Bainbridge Island, the city of Bremerton, and the city of Port Orchard. Next slide. So these are the percentages of the settlement. So Kitsap County receives 2.6%, which seems very small, but of some of these quite larger numbers, it is a decent amount. We do highlight Poulsbo. Poulsbo is the only city in our region that is not part of the Kitsap County funding. So I like to call that out when we're having this conversation, just so folks are aware that that portion of the funds does not come through our organization.
Can I ask a quick question?
Yeah.
That 2.6% is for the overall for the whole state. Is that correct?
It is 2.6% of the state allocation of the larger settlements. Yeah.
Okay. Thank you.
Next slide.
I have a quick question, just tagging on. So you said that Paulsville was not part of it, and I didn't do the quick math in my head, but the Paulsville, the Kitsap County total included the Paulsville amount, but it is not included.
No, the Kitsap County total does not include the Paulsville.
So the Kitsap County
Each of
total
those
is your total
is the
allocation.
allocation
Gotcha.
specific to Kitsap County. Then we add on Bainbridge Island, Bremerton, and Port Orchard.
Okay.
Also a municipality that opted not.
Correct.
So the point,
And
which
we
is a
also-
tiny amount, but
And we also receive directly the funding for Jefferson and Fallon counties.
okay.
That comes into our pool that we then separate out and disseminate to those counties as well.
Okay,
All right.
thank
So-
you.
Absolutely. The initial funding strategy was a plan for 2 years and a little bit of lead time. So those contracts started in April of 2024, as you'll note here, and that funding is expected through June 30th of 2026. Those were determined to be provided for primary prevention, community education, and naloxone supply for community supported cabinets. So that is the only funding currently out of the initial distributor's settlement that has been dedicated at this time. So we are still in planning phases with all of the remaining funds.
So, since we've been asking a little bit of questions, do
Yeah,
you mind if we do
please.
that?
Yeah.
Is that all right?
Yeah, I think it's the only way we could do this.
I'm interested that since thank you for this. This is exactly what at least I was looking for. I don't know if you've met all of our needs, but, so and it could come in the next slide. What are you anticipating?
We'll get there.
And when, so that we have some kind of a forecast, and then backing up, how are those settlements communicated? Are those communicated through city attorney's office? Because I think generally that's where we hear about them, is through the city. I'm looking at Brett.
Oh, yes.
Yes, okay, all right,
Yeah, so the settlement attorneys send them directly to the jurisdictions
okay.
with who the settlement is for. So Kitsap County receives Kitsap County, Baldwin County theirs, Jefferson theirs, and then the funding of those comes to us. You guys get yours directly. You then forward the funds to us.
Right.
Currently, the funding from Bremerton, out of Bremerton, was $924,380.66. So that is what has, as of June 30th, 2025, that is the number that we have received.
Nearly a million.
24,000.
Yeah, 924,380 and 66 cents.
380. That is 60 cents.
66.
66. I wanted to ask about your cabinets and the efficacy of how that's working. I just saw one for the first time today over at the People's Exchange on Fowler.
I can show you a little data on that.
That'd be great. Thank you.
Slide deck as well.
Okay.
So just also wanted to share the current Kitsap total is $4,735,081.43. That is what we currently have in the pool, with an expended amount for the programs that these lovely ladies are going to talk about in a moment. And those expenditures currently are at $670,850. So that one has the only portion of that $4 million that's been allocated out at this time.
So the percentages are based on city population and at the
The
time?
percentages are based on a very complex algorithm that are not necessarily based specifically on population. They are based on several factors, including the impact of opiates on a certain area. So areas that had higher opiate impact received a higher percentage. For example, Clallam County was one of the most challenged areas in the state of Washington, and their percentage per capita is higher. So there's a very complicated algorithm that determined, based on statistical data around opiate deaths, overdoses in emergency departments, is how they calculated that algorithm to determine what that.
But within
amount is.
Kitsap County, the county gets 73%, Bremerton gets 17%, Bainbridge Island gets 4%, Holsbo Port Orchard gets 3%.
Yes, and
So
those
that's population based? or-
percentages were determined by the state based on the algorithm, based on the impact
Not
of opiates
population
to
based.
that community.
Really? So
Impact.
They thinks that Bremerton is only 17% of the impact within the entire county?
No.
No, it's not that linear. You know, so like the decisions, the way it's been explained to me, and again, not the lawyers who made all these
Yes,
decisions.
I get it.
And the state ultimately said, this is your percentage, and it was based on, so they said, if you had this many overdose deaths between this amount, you might get this additional 0.5%. If you had, this occurring within your city bounds, you might get an additional 0.5%. So that's how we saw Clallam get a higher number.
To Jane's point though, 17% of what then?
We're 17% of what the county
Well, she's
total
looking at
is.
the county
But,
total.
but does all the county totals add up to 100?
Yes. Well, 99.
Okay.
Yeah, I mean, if you do the math within
Pretty
the
close.
allocation that we receive from the city of Bremerton based on the state
97%.
allocation is 17%. So the state determined the amount that you received, and of what is received within the county, 17% is specific to the city of Bremerton.
Yeah, anecdotally, that sounds weird, but okay. I know you're not the decider, so I'm just, thank you.
But I mean,
And I also
with the
think
county
that
getting.
it would have been raised by.
Yeah,
some,
by
you know,
But are
five.
we second though?
concern.
We're
Seventy-three
second, but
percent.
county gets 73, we get 17. Bainbridge gets more than Port Orchard, which is a smaller population wise, but I would guess that they would have a bigger population of people affected by opioids.
Maybe this is something we could dive into.
Per capita.
Another way.
Per capita on
Yeah.
Bainbridge.
Yeah.
It is not something that we have control over.
Right,
It's
yeah,
determined.
I get that.
Well, and some of it also has to do with the number of prescriptions, I believe, that came out of that area. So Cambridge may be higher because they
Yeah.
had more dentists. Who were, which is one of the contributing
That's
populations. That
interesting.
is
That's interesting.
providing more prescriptions. They may have an older population, which is a population that has been
We,
significantly hit.
Perhaps.
We have a-
for years, but not acknowledged as highly.
we do have a large unincorporated area, not just Silverdale, but working out past,
Yeah.
all the
Well,
way to
that doesn't-
Mason.
Yeah. that
Between
doesn't
Mason and
include
Kitsap.
Olalla and all those other areas.
Perhaps,
Manchester that are not
Jane,
part of the
if
city.
we could ask, and since Brett is standing right here, if we could ask simply for a more, not a more thorough explanation,
Yeah.
but just maybe an explanation of why it appears to council that the percentage may be lower than the impact actually is. How do they measure,
We're assuming they didn't throw darts at a dartboard to pick a
Right.
percentage.
right,
So,
right. But
We'd like
instead
to-
of wait.
Probably not gonna change, so the
No.
settlement's the settlement.
No, and,
So
and this
Yeah.
isn't something that they
Yeah.
can change.
Yeah,
Okay, sorry.
And the algorithm.
yeah,
we already signed the document.
Yeah, I get that. I'm just trying to figure out how they determined that. This isn't the place to find the answer.
And I will see if I can find that algorithm. I've seen it. And I quickly ran away.
yeah.
It is quite fun.
Let's hope the person who made it is crazy.
So currently, the initial funding strategy for Kitsap, again, involves these three items. And those allocations end June 30th of 2026. Next slide. So this is a specific funding breakdown of what those look like. Like I did mention, we currently have expended 670,851. So we have not yet hit our 785. And these are specifically allocated to the programs that we are going to review in a moment. So next slide, I'm going to hand it to Dana Bierman.
Hello, everyone. My name is Dana Bierman. I'm with Kitsap Public Health District as the Chronic Disease and Injury Prevention Program Manager, and I have been fortunate to be some of the early recipients of the opioid abatement funds in my program here. As Jolene already said, some of the three focused areas that we have focused on are shared knowledge, community engagement, and education, and strengthening supports. We have been focusing on those for the past 15 months. We started this funding, as you said, April 1st, 2024, and we're now, August. And some of the decisions that we made moving forward and moving these focus areas, some pre-work we did, highlighting before the funds came out, we did a little survey, informal surveys to 18 organizations that serve folks who may or may not be using substances, but are working within the community with needy substance users, and really found out what they are interested in, what we can do. And what we heard is we wanted to know what was going on in the community, how we can do better in Kitsap, and how do they think KPHD, Kitsap Public Health District, that's where I come from, the lens I come from, how we can help. In those interviews, we also heard overwhelming information that people want to know the data and the trends regarding opioids and opioid use. They want to see increased partnerships and collaborations in Kitsap County around supporting those who use substances, especially opioids, and more education and resources. So that's where we started. So next slide, I'm going to talk a little bit about some of the data, the shared knowledge. So with this funding, we were able to hire an epidemiologist that has been able to develop a comprehensive overdose dashboard that is live on our website. Anyone can view anyone can view recent data that we have from Kitsap, from deaths, hospitalization, trends, overdose, prescriptions, etc. So if you haven't had a chance to look at that, I highly suggest you do. Along with the data dashboard, our epidemiologists have been working with many community organizations to do a collective networking map, and that demonstrates the connections that organizations have in supporting individuals with substance use disorder. And this map is a comprehensive and for organizations only, and that's again responding to the need of like, we don't know what other people are doing around supporting folks, so how can we do this map? It's been it's been a lot of work, but I'm happy and pleased to note that our staff working on that, along with an epidemiologist, will be presenting on the networking map at the Washington State Public Health Association and the work they've been doing with connecting organizations through that. We also, part of our epidemiology work is sharing resources and doing presentations. Our epidemiologist attends quarterly the fire chiefs meeting and reports out on their data. We have access to their WMSIS data and kind of what they're seeing, and it gives us an opportunity to share trends, but also to talk about some of their concerns and be able to strengthen that collaboration, which has been important. We have also done a lot of data presentation through requests throughout Kitsap County, anywhere from nonprofits. I think we've been to some very small organizations sharing opioid data to, larger community forums. So we're open for that too. Our epidemiologist loves to come out and talk about data. And I know there's often been a lot of community questions around what's going on with opioids and, what is the landscape right now in Kitsap County. Sharing knowledge also includes media campaigns. We've done quite a bit of media campaigns, social media. We've done, and I know you'll talk a little bit more about Friends for Life, but developing a lot of media and sharing what we know and how we can support. Next slide.
Yeah. Question, please. So you were saying that you're connecting to other people who are doing the same work because at this time you don't know who else is doing this work?
What we heard, not necessarily, yes, and what we heard is that a lot of people didn't know who were supporting folks who use substances. So when someone might be using substances, it could be a variety from, actively using, in treatment, recovery, and then prevention is where we're really focused. So we often talk about, supporting folks along their journey. So people did know a lot of what we heard in our 18 organizational interviews is people wanted more connections with folks supporting substance users. So what's going on in the treatment world if we're in the prevention side, or what's going on with, the whatever services that they may not know about. So people wanted to know what other people were doing.
Okay. So have you had time to meet with just some of the organizations that are very active here in Bremerton? Rock the Block, Prayer Walk, God's Broken Home University, KCR, of course. And you had a chance to meet with all of them?
I think they're all part of the network map.
Great.
Absolutely, yes.
That
Our staff
was my
has done a
question.
great job, and they've attended some of our networking meetings. Yes.
Great, thank you.
Oh, and the real team is funded by, is that what I heard too? The real team is funded by?
The real team is funded by the ASO side of our organization. It is not funded by
So-
OPM funds.
So the real team though is really great at making the connections to those organizations.
Real art cares, yeah.
And we've been collaborating with them also through our network and our networking map.
Great,
sharing our
thank you.
resources. Community engagement and education. So we have done a lot of naloxone education and distribution. I think you're going to be talking a little bit more about that because this has been something we've all been focusing on. I'm in the first year, we gave out 184 naloxone kits and trained 490 individuals in Kitsap County. Just from Kitsap Public Health. We're not the only ones. This has been a collaborative effort that everyone's been working on. Our education around naloxone really includes non-stigmatizing language and provides education on substance use disorders. So we found that that's really important to educate the community on that. I think we've hosted several in the Bremerton area. Advisory groups at Olympic College in collaboration with the Olympic Recovery Rangers. We have started an advisory group that meets regularly to discuss how as a community we can better support those who all use substances. We hope that through this advisory group, we can glean information from folks with lived and living experiences to help us increase our strategies and our planning in the future. Overdose Awareness Night. I did bring some flyers here. On September 5th, we are hosting an Overdose Awareness Night, an opportunity to honor those we have lost to an overdose. It's at Evergreen Park. I'll leave these here for folks. That will be an evening event from 6 to 7:30 p.m. And then lots of coalitions and networks. We participate in a lot of coalitions and networks in this area and part of just being out. We've also had one of our staff member be trained in the science of hope and has done outreach and support to nurture hope at several organizations and is out and is available to do presentations and education around hope and around, especially focusing on substance use disorders. Next slide. And the final bucket of work that I often connect to the strengthening supports. The role of public health is really to strengthen supports with their community and connect individuals to resources we need. We've used a little portion of this funding to fund some of our parent-child staff at Kitsap Public Health. And I don't know if you're familiar with the pregnancy and parenting hotline, but some of the calls that have come in, they've been able to connect pregnant persons to substance care via the prenatal clinical leadership collaborative that they're part of. The advisory boards, we have been in attendance of many advisory boards and connecting through many coordinated events, such as the most recent OCH care coordination, and making sure that they're aware of, the organizations in our community that can support someone along their substance with substance use disorders. We have the buprenorphine as a medication used to treat opioid use disorder. Our health officer and our staff have been attending meetings in support of low barrier buprenorphine in our community. And currently, St. Michael's Medical Hospital and a newly expanded Washington State telebuprenorphine program are offering care and just started offering that within our area. So that's been pretty exciting in the past 15 months, we've done just a lot of collaboration, connection, prevention, education. We have developed a distribution list of about 170 community partners that receive our opioid network updates. In the future, we look forward to continuing doing this evidence-based work. And I think that wraps it up for me.
Real quick, so when you're talking about distribution, was that the boxes that I was gonna ask about? Okay, we're gonna get some more information.
We do mainly community events where we do an hour-long training talking about substance use disorders and how to use naloxone. And so we do larger community events or one-on-one trainings.
Great, thank you.
The boxes at PEX or Grace Crowley, or she started it.
Yeah.
Yeah.
But it sounds like it's probably something that they got from this organization. Yeah, so it's their box that they, yeah.
Good.
Exactly.
My name's Laura Hyde.
Hi.
Hi. Thank you so much for inviting us here and providing an opportunity for us to share all our hard work. Our focus is youth substance abuse prevention. So if we can prevent them from using opiates in the first place, then we're going to save a huge amount of people and resources. And so that's been our focus. Our division, Substance Abuse Prevention and Youth Services, has been with the county for about 20 years in one form or another. I've been lucky enough to be with them for 11. my colleague's been with us for 10. And so I share that because we've learned a lot in the process about what is science-based prevention and what is effective with young people. So basically we hit the ground running, hired a staff member to help support with some of the basic duties around running a program that kind of freed up myself and my colleague. We just have the three of us in our division doing this work. And so together, Deanne and I, Deanne Jackson is my colleague, and we've been doing prevention with youth for well over 30 years. Oh yes, thank you, please do. Thank you. So these are some of the things that we've done in the last 15 months. We are focused again on very much science-based substance abuse prevention. And so we developed evidence-based programming that is specific for opioid prevention for youth. And so we adopted Guiding Good Choices, which are parenting and caregiver education. We've had 3 series, 2 of which have been virtual, and our one in person was here in Bremerton. We have environmental strategies utilizing the Washington Friends for Life campaign. And so that's a campaign that the state developed with youth, informing them and telling them what's, gonna work and what isn't.
Mhm.
And we've utilized that campaign in partnership with public health in just a whole host of ways. Some of which social media messaging, we had billboards, we had one on 6th Street for 12 weeks here in Bremerton, one of our 2. We created a commercial and played that at the Sea Film Theater. And that ran for, I believe, 12 weeks and had over 7,000 people see it, was their take on it. We had billboards in the Kitsap Mall and car wraps around some vehicles, some professional vehicles that are in the community all the time. We were able to fund hidden in plain sight education events, and we had 5 throughout the county, 1 in each school district. One here in Bremerton was at Mountain View Middle School. And so that's basically where they had set up a mock teenagers room. And in there are a lot of things that might trigger a concern of mental health and substance use. And so then the professional trainer works with the people in attendance for about an hour. And as part of that, we had staff training in the schools. And so these events happened in schools in partnership with the schools and invited as many people. And it was for people over 21. So there were a lot of talk that we didn't want to have the students learn new things. And so as far as how to hide their substance use. So we shared that
That kind of
information.
thing.
Yeah, I could see that. I'm sorry, that was one day, right? So we also did a whole bunch of presentations with schools and youth serving organizations. Just in Bremerton, we've had over 15, and actually I think the count was 22 for different, that was presentations, 15. We also supported National Prescription Drug Take Back Day events, and those happen twice a year. And we really advertise them and try to get people to come in and turn in their prescription drugs into the boxes, of course. But we worked with Peninsula Community Health, and they have pharmacies. And so in their pharmacy bags, we were able to provide some education materials using the Starts With One campaign. And then they were able to give those out to their customers with their prescription, of course, in it, with information about how to get rid of them if they have anything left over. We do a lot of education and outreach at local events because we want to meet the people where they're already meeting. We're looking to educate adults. We're looking to educate youth with two different ways of doing that. Some of the events just here in Bremerton, Overdose Awareness Day, Recovery in the Park, Juneteenth, MLK Day, Kitsap Youth Rally, Youth Empowerment Conference, 12+ events with Bremerton service providers, and 4 with Olympic College. Altogether, we had over 22 occurring in Bremerton in the last 15 months. We provide support for positive youth activities and events, because if we can keep our kids busy and doing positive things, then they are research proven to utilize drugs and alcohol less. So by keeping them busy doing positive things, they're focused and active and busy. So we support and share information around after-school activities, youth conferences, all sorts of fun stuff, summer programs, the summer reading program at the public libraries, and youth advocacy and education. We support and sponsor the Kitsap Youth Forum, again, in partnership with Public Health. We work together on that. And the My Shoes, My Story project, where we go out to youth groups and provide canvas shoes and art supplies and talk with them and guide them. What would you like to share with people making decisions for you and about you? And so they have messaging that they put on the shoes. We created a video, you can see it on our website. And we're also in the process of getting those images out, hopefully to many, many people such as yourselves that are making decisions about our young people. So that's kind of the gist of what we've been doing, trying to focus on youth substance abuse prevention. Our plans really for the future are to expand. That was just
Next slide.
Yes, thank you. That was just the beginning.
Yeah.
Thank you. And so up at the top right, there's our billboard on 6th with the Friends for Life campaign, talking about your words matter and talk to your kids. And then the second picture is at one of the Hidden in Plain Sight events, because the other part of Hidden in Plain Sight, we also had resource tables. So it was a resource fair, school education for staff, and for the community, all in one. And then that bottom picture is of the Kitsap Youth Forum. And that was where we have young people gather questions from other young people throughout the county that they would like to ask of key leaders. And our youth facilitate that event and shared questions with the leaders. And then the leaders came with questions that they wanted to ask youth, because they don't often get that opportunity. So it was a wonderful exchange with a lot of laughter and smiling and just really connecting. I think it was a fabulous opportunity for the kids to be involved in the government process and feel they have a voice. So we know that when youth feel they have input into the decisions that are being made for them, they feel more empowered and are less likely to use substances. This is one of the activities that has been research proven. Encouraging advocacy and leadership skill development is one of those ways. So we're looking to add a second evidence-based program, positive action program, which is a service directly for youth. And right now we're doing it up in the Kingston Boys and Girls Club, and we're looking to spread that around the county more. And that's also an evidence-based program for opiates. And then increasing the support for positive youth development. So the more things that we can have our youth doing, the less likely they are to utilize drugs and alcohol. And so that's what we've heard from the kids. They want to have more stuff to do. And we're working at supporting that. And then increase our school presence, our school communication with staff, presentations with the youth, with the students, as well as getting some of that imaging into the schools. So we were able to get posters with the Friends for Life campaign that were focused on youth into the schools. And we'd like to have a lot more coverage of each individual school, more in the hallways. So in conclusion, that's pretty much what we've been doing with youth substance abuse prevention. And I just have to say that it's the best way to spend money. It's been shown that for every dollar spent on prevention, $18 are saved on services. So youth prevention is very, very effective. It's also very financially effective if it's administered utilizing research-proven strategies.
I have a couple of questions.
Sure.
I love prevention. I started my career in domestic violence and prevention back in the day, went out into schools, loved them, and I believe in it. And I agree with you that, you know, investment, a small investment now pays off. It really, really, really does. And I might even lessen my concern about duplication of services over something like this, because there already are programs out there providing activities for kids. I'd love to give them more money instead of starting new programs. That's just the way my brain works.
Mine too.
Yeah, the only question I have is sustainability. These settlements are one-time payments.
These settlements actually pay, depending on the settlement, between 6 and 17 years.
Oh,
On a
great.
graduated,
Yeah.
some get
Less
bigger,
and
some
less?
get smaller. No,
Okay.
some get bigger, some get
Oh,
smaller.
okay,
So that's part of the complication
okay,
of these funds. So they do, so we are in year 4
okay.
of the 6 to 17 year cycle, depending on the funding source, distributors, pharmacy, some of the newer ones coming through. We haven't seen yet what those timelines, some of them are one time, but many of them have an expected trajectory over.
And
a
you
period of
factor
years.
all of that into decisions made
Absolutely.
about how to allocate that money,
Yeah.
which is probably why this council voted, let's put the money there so that we don't have to make those decisions. And it sounds like you've covered a lot of bases. The collaboration here is really, I think, remarkable, and the ongoing collaboration. So my only thing is the concern about duplication of services. But prevention, boy, let's maximize it. There isn't a lot of money out there for it.
So I have a few more slides. Wanted to jump into the naloxone. Maybe that we're kind of running short on time. Next slide. So one of the projects that our organization has been working on since 2024 is our naloxone cabinet project. We're providing cabinets across all 3 of our counties. We provide them to anybody who comes and asks. So we do try to target those in areas that we know are impacted. So we have been working on getting some data from the fire departments regarding overdose data to try to increase the efficacy of those programs. We provide the cabinet itself that is funded by us. Again, this is not funded. This portion of it, this project is not funded at all by opiate funds. It's something that our organization has done independently. As part of that, we've been partnering and we created a locator map. That map includes anybody who has a cabinet who is willing, so not just our cabinets, but tribes have provided cabinets, Aquamish, one of the first in the state to be doing that kind of work. And we actually have a QR code where somebody can scan it on their phone and say, where is the closest naloxone cabinet? And it will walk them right to that cabinet, show them a picture of it. And you can actually hit your Google map and it'll give you like the walking or driving directions. Next slide. Just want to share a little data. This is the 3 county data, but blue is Kitsap County. So this is 24 distribution and 25. Most of the funds directly related to opiate funding land in that second category of cabinet distribution. hot off the presses, we just finalized our contract with Kitsap Transit, and we'll be placing cabinets in 2 transit centers in Kitsap County. So it's been a long, we don't know yet. It's been a long project. That we just signed the contract on Monday, so we will be finalizing that. I believe the initial conversations were Port Orchard and Bremerton ferry terminals.
That's very true.
To start there. And then we'll just.
Our
expand
next
from there.
Kitsap Transit meeting is on Tuesday, so.
Well, you might hear that. And so we anticipate some of the funding from opiates that is purchasing naloxone will contribute to those boxes. All of this naloxone is, again, some of this is funded by opiates just for Kitsap County. We also have a partnership with Department of Health, and we have our own budget related to naloxone purchasing for this project. Next slide. So that's kind of the naloxone. Any questions about the naloxone before I jump into kind of our
What's all the shelf life of a dose?
depending on the box, 2 to 5 years. But even some of the conversations, they did some extensions on some of those. So we like had to put these little slips in all the boxes. And most of the boxes are only doing intranasal. We also do have access to intramuscular that we are also getting in the community at the request of individuals who are using drugs, as it has a more efficacy in those.
So I keep them in the glove box of my vehicle, and somebody told me that's a bad place because of the
I was just
heat.
about to ask about the heat.
Yeah, the request is to try to manage heat.
So the box is outdoors.
So we actually have had conversations with our providers around placement of those boxes, where we're keeping those, and how much they're stocking in those boxes during times of too cold or too hot, to be thoughtful and planful, to make sure there is access, but also to be trying to manage the supply and not cause damage.
So is there any way to know if what you have is still effective? Because, I mean, I've kept it in my glove box. Been sitting a new one I put in a year ago when I bought a new vehicle.
So I would check your expiration date. There is no way to tell from the outset, but most anecdotal response is trying it is better than nothing. So don't not use it, and there will be some
Get a
efficacy.
new kit.
Yeah. Or
Somebody from the recovery ranger said, you know what, just keep it in your purse.
Yeah.
Keep it in your
Keep it on
bag. Yeah.
I mean, the glove box heats up. At least it's the most insulated, but once
Yeah.
it gets there.
I had a question about quantities, because the shots of naloxone needed have gone up by like 30 to 50%. So that's all being taken into account in how much you distribute.
when you say quantities, the number that the amount that people need, or the dosage?
It used to be that, and I may be wrong, but I'm not far wrong. It used to be 3 to 4 pops, and now it's like 6 to 8 pops.
So it really depends. There are currently several variations. You can get 3 milligram, 4 milligram. They just actually approved the 8 milligram. We're not doing any of those in our region. Mostly it's 4. The original kind of historical recommendation was, 2 administrations. And then with fentanyl over the last couple of years, up to 4. We do not have a limit on what is available, so folks can come if they need to take 3 boxes with 2
That's
kids,
great.
3 kids, 2 doses each.
That's
Please
great.
do.
Thanks.
We'd rather people have it than don't.
Yeah. Thank you.
So I know I'm a local business owner who owns a bar who looked into getting a box for that bar.
Mhm.
When she talked to her insurance, she found out her insurance rates would kind of skyrocket if that was in there. And I don't know if that's something
Really?
specific to her insurance or if that's something you've run into before, or if there's any sort of like waiver or coverage.
So administration of naloxone, it is at the discretion of the individual. There are, protections for community members. We do have a couple of businesses who do hold it. Some of them hand it out and have it in their area of business and have made that choice. We do not ask them about their insurance status. That's really for them.
Interesting.
And some of them make a decision as to whether or not their staff will administer or they will just make it available as an opportunity.
Insurance companies are killing us.
I think, and some of that really is, are you administering it and are you taking responsibility?
Versus having it available for something else. Okay.
Versus, like similar to having a condom machine in your
Not
back.
the condom machine.
What? Well, I'm not administering it. Never mind. But so the specifically they called it, it was the box itself, or was it the presence of the boxes on site?
I believe it was even just having it on site.
You brought this up a few years ago.
Yeah,
And we have seen some private businesses who have partnered with us in that.
Better not name any names or their insurance rates are gonna, the actuaries are listening. All right.
All right, so just wanted to jump into, so one of the things that we have also done related to specifically the opioids is to put out this opioid response community survey. This survey actually was out for 9 months. And it actually covered all 3 of our counties. This is the specific Kitsap responses, 31% of those responses. And the choices on the right-hand side are specific to the remediation strategies in the settlement agreement. So these are areas that have been identified. There was a further breakdown. I will show you those slides, but with being short on time, you probably can look at those later. Ultimately, 31% of individuals said make it easier and quicker for people at risk to access care and support. And then preventing some overprescribing. So there is some interest in educating prescribers in how to manage opiates. In particular, more recently, again, we've heard an increase in dental administration of opioids. And so had some requests around that being a consideration for the allocation of future funds, offering education in the community and schools, which is what we have been doing, and increasing access to naloxone, which we have been doing. So it was interesting that we did this survey. Well, apparently we were right on task with what we're hearing from our community.
But are you? I mean, 31% of the people say that they want. Can you make that slide the normal size, Michael? Making it easier and quicker for people at risk to access care and support. We have there's no good providers for people to go into any kind of treatment in Kitsap County. And that's what I believe 31% of the people are saying we need.
You mean medical detail?
Yeah.
Chemical detox.
Chemical detox. Whatever it is.
It's important to know the difference, but I think you do know the difference between the different kinds.
But that's what we don't have. So, I mean, it's great that you're spending money in the schools and prevention is important. I get it, but we don't have any money that I see going towards actual treatment.
Currently, none of the opioid funds have been dedicated towards treatment. That is accurate. And again, this survey was to help formulate the plan for additional funding. So when I said we are covering many of the priorities in that first round, the things that we said, these are probably kind of where we were before we ran the survey. We were meeting some of those. I think when we talk about medical withdrawal management, that's a whole nother issue. I'd happy to come back and talk with you about the logistics around that and the necessity in our community and what that actually looks like logistically, because we do not have the demand in our community based on the data to support a facility like that in our counties.
So
we don't have the demand.
We do not have the demand in our
for the
community.
medical.
And I think the challenge that continues to come up is not very many folks actually meet criteria for medical detox, and medical detox means 24-hour medical supervision for that detox. Most of the folks are going to be in an emergency room if they are meeting that need and are being served there. And so we have seen statewide a number of those facilities closing because there is not funding.
Okay, so then
due to census.
I'm using the wrong term then. Treatment for people who have addiction problems. Are you saying that we don't meet the criteria in this county to have a treatment
We have
facility?
treatment facilities all over.
We have 3 residential treatment facilities and several outpatient treatment facilities in Kitsap County.
Well, it seems like it takes, we have a contractor, Common Streets, and they're having to go to Raymond, Washington, to Eastern Washington, when Bellingham. So we can't possibly have enough if they're going that far. Go ahead, Jennifer.
Yeah, so
I
no,
know you
completely
disagree with me.
completely agree with you that we are, what we're doing, what did you just say?
Well, you wanted to jump in, so.
No, yeah, well, so we specifically approved the use of these funds to be used for this survey. This is what we agreed to and we signed on for. So they're delivering the product that we asked for, that we signed on for, that was proposed to us, okay? So thank you for delivering on that product. What you're speaking about as Common Streets, trying to find beds like immediately right away for folks. Sometimes some people do elect to go to a different county. As somebody like in recovery, like I know this, they elect to go to a different county because that gets you out of the place where you're getting in the most trouble. What I would like to know is if there is a short, like a treatment center, some people don't qualify for inpatient also. Some people only qualify for outpatient. So that part, I would be interested in knowing the stats for that. How many people who are qualified by an evaluation for an inpatient treatment center are not able to find a treatment center bed in Kitsap County of the 3 facilities that provide inpatient treatment?
So who makes that determination if they qualify or not? A DCR?
It's the people that do the evaluation at the treatment centers. So there's several different kinds.
Designated crisis responders only are responsible for evaluating if an individual meets involuntary treatment requirements where they can be detained against their will and have their rights removed to receive treatment.
So you go.
It is uncommon on the SUD side, but it does happen. The decision to answer your question directly, the decision related to medical necessity is made by treatment professionals who are trained to make those decisions. Just like when you go to your doctor, they will determine if you need to see a cardiologist. If you can go in and say, I need a cardiologist, and they're like, well, that you just pulled a rib, they're not going to send you to the cardiologist. They're going to send you to a different doctor. So those decisions are made by substance use disorder professionals in those organizations who can make those determinations for that care. And we will see in the next couple of years, and unfortunately it got put off, the implementation of ASAM 4, which are the care criteria that the state of Washington goes by, particularly for the Medicaid population, that applies across that spectrum of care, that hopefully will be making it easier in the state of Washington for those folks to qualify. I will definitely be very clear, there are not enough beds. People do go out of region. People also come into our region for care and take some of those beds as well. So it is a very interesting flex. And really it is a challenge when it comes to any sort of bedded service, because there is it's kind of like you call and who depends on who's there and who has a bed. And so they may have a bed in Longview and we're going to take that bed in Longview. We're not going to wait.
Okay.
And to my point about people going in and out of the county, that is a real thing that happens. People absolutely want to get out of the county where they have their network of people to start a new life. So that's part of it too. Yes.
Well, I'd be happy to also come back. We also have a pilot program. We're providing transportation with our real teams in G2.
I'd love to have her
folks
back.
getting in and out.
Okay, well, let's,
Come back and talk.
I want to get some clarification by something, but Anna's been very patient. Go ahead, Anna.
Especially for me.
Yeah.
So when you were here, what, 2 years ago, 2.5 years ago, something like that?
Last October.
Yeah. When you were first here, when you were first awarded these funds?
Yeah.
I asked if you thought that these funds would be usefully applied since you were not going to be adding any beds. And one member of your team said, no, that's going to make it much less effective, but this is all the money we have.
Well, and at that time, we only had the distributor settlement, which was less than $1 million.
Yeah.
So things are looking different now as we've seen additional settlements and several years in.
So do we have a chance at this time to get you to collaborate with you on creating a chemical detox somewhere on the Kitsap Peninsula? Because it's not just Common Streets who contracts with Bremerton, it's also Rock the Block. It's also a number of other organizations that are now, fortunately, are able to work with G2, but in the past, we're rolling out of bed at 3 a.m. because when somebody's ready to kick, you've got to get them there right away. So is there any chance that you collaborate with us on funding or lobbying or building a chemical detox facility on these?
There's not enough money.
So we do have one, the Recovery Center does withdrawal management.
They
at
do
their
social
facilities.
detox.
They do subacute detox.
Subacute means that they don't do the intravenous, right?
Right, so people there can be medicated by a provider, but not require medical supervision.
Yeah,
And
that's
the
over in Port
difference.
Orchard, right?
Yes,
Am I correct?
yes. We did have a second one in Collin County. It closed due to lack of census.
Okay,
They
well,
were not able to keep bed numbers to keep that facility open, and they ended up closing in 2020.
okay,
Related to
Well,
that.
so,
And it had nothing to do with
2020.
COVID.
Okay. all
It
right.
was, they closed in April because it was a planned closure because they had been unable to keep a census. I think the challenge that we've continued to struggle with is the data that we have doesn't support that level of care of acuity. I will also say on the flip side of that, the reimbursements for these types of facilities, because they are not funded on a capacity basis, which means they're not funded to keep those beds open all the time. What often happens, there are 5 days a month where they are going to be full and they're going to turn away 20 people. There are also 5 days a month where they have nobody. And so it makes it really challenging when they only get paid for the number of people in their beds to manage a capacity facility. So I think it's definitely worth continued conversation, but we also need to be able to make it sustainable and have data that supports that need is accessible.
in my vulgar way, the answer to my question would be no, we are not in a position to collaborate with you. And B, we're not going to do that because there is no
Aren't
demonstrated
collaborating.
need.
That wasn't fair.
On
We
the
are.
chemical, on,
No,
my
what
question
I'm gonna
was,
say, I will
can I
answer.
just repeat my question? please?
Yes. Let's
Would
make sure
you
it's
be
factual.
interested in collaborating with us on funding or lobbying for or building a chemical detox facility on the Kitsap Peninsula? And it seems to me that your answer is in the negative, because there is no demonstrated need for that.
So my answer is we are absolutely willing to collaborate, but we also have to make sure that particularly building any program, it needs to be sustainable and it needs to meet the need and the best interest of the entirety of the community and those funds. We couldn't build a building and have it sitting there and then not be able to run that building and keep that building funded, and then that is a challenge, right? But I think it's definitely continued parts of the conversation is how do we do that? But when we continue to talk about medical detox, I have been very vocal that we do not see the data that supports anecdotal reports from our agencies, and we oversee the real teams, 5 teams in our 3 counties. So we hear exactly what you're hearing from Common Street. And when we ask the more clear question, most of those folks need subacute, so they need the similar level that we already have. And yes, there are not enough beds, and part of that is due to the payment structure. And so, yes, we are very much on board to support advocacy around the payment structure.
I'd like to
and
move
Yeah,
on.
okay.
these pieces.
Yeah,
Let's time out. Everybody gets one final question if you need it, okay? Because we're over an hour into this conversation. Michael?
I got
one more?
nothing.
Jeff?
My real quick one is with a lot of first of all, thank you for all the work you do. Thank you for the presentation. Thank you very much. It's been extremely helpful. For terms of measuring the success of the prevention strategies, right? If we come back in 5 and 10 years and say, hey, how effective do we think everything was? What's kind of being measured to provide that? I know it's an extremely difficult thing to measure because it's not exactly a controlled experiment. So, yeah.
So I can speak directly to the naloxone project. We have seen a decrease in overdoses or overdose related deaths across our counties over the last 2 years as we have been distributing this. So we like to think that again, it's anecdotal. We don't have reports back that, hey, I saved so-and-so, or I was saved by naloxone that was provided by Salish. So we are working with public health on some of that data just around overdose use, overdose data, use data, treatment data, which is a little more challenging since integration of managed care. We don't have the Medicaid data that we used to have as an organization, so we only get to see a small portion of that data. We've been trying to work with them to get that full picture, which I think would also help with both your ladies' concerns around how are we identifying folks who are being turned away or not getting access.
Okay, Denise, do you have another question? Anna?
no, I have no further questions.
Jennifer?
So we have some confused terminology that we're kind of, I just want to make sure we're clear. So we talked about subacute, we talked about chemical, and we talked about medical. And those are all 3 different kinds of detox, correct? So chemical detox would be like without, needing to have medications, but going in and detoxing off of whatever substances.
Or those, you can include some medications.
They can include some.
That do support that process and make people less uncomfortable.
And then subacute, what's the difference between subacute and chemical?
So you can be using chemical in a subacute facility or you cannot. So a subacute can serve both of those populations.
Say that one more time. I'm
So a
sorry.
subacute, so I can go into a subacute facility and be prescribed medication that is then prescribed by a doctor, or I can go to subacute and not be on medication.
Okay, so subacute means you're prepared with doctors to do some kind of
Means you're in-
intervention,
you're
but you
in a-
don't have to have 24-hour supervision.
Well, you're in a generally subacute means you're in a 24-hour facility being monitored and supported by individuals generally in that, and you can be on medication or not in those facilities.
Okay, medical detox. Can you give me an example of a medical detox? Like
Most
somebody who
common-
needs a medical detox. and
Most
it-
common use for medical detox is individuals who have chronic alcohol
Right.
withdrawal, and if they go off of that
Exactly.
withdrawal without direct 24-hour medical support with doctors and nurses, that it is imminent risk to their life.
And that would be at the level of, we're talking to the point of like wet brain or cirrhosis.
For individuals, it varies. It can be
Yeah.
6 months for one person and 10 years for another.
Okay, all right, thank you very much.
Okay, Eric, did you have any questions?
No, thank you.
Okay,
So can I jump 3 slides? I have one final slide just to show you guys the
One
next
final
steps
slide.
for review.
Thank you so much for your time.
Was that Eagles, Michael?
I don't know what it was.
Oh, that is not eagles. That's the thing that keeps the seagulls off the roof. It's not real.
So those slides I'm giving is just additional direct information. So these are our next steps. So we are considering an RFP process for future funding related to the priorities that have been identified in the region. Continued outreach to individuals at risk. Overdose follow-up support has come up, and that will be some of those outreach programs that are directly supporting those folks and getting them to treatment post-overdose. And then we also just wanted to note that we will be looking at the renewal of those interlocal agreements at the end of this year, so within the next couple of months.
okay, I have one final question. There's another group apparently with Salish in their name that runs the Volunteers of America hotline, the 988 hotline. Do you know
So-
which Salish group that
Regional
is?
Crisis line?
Yes,
Yes, so they are contracted through our organization, the Salish Behavioral Health Administrative Services Organization.
okay. So I met with Kitsap Mental Health and they told me, their top staff, that over 95% of the calls that go into 988 are not referred to them. That,
988 and the Regional Crisis Line are different entities,
okay, the crisis line, I'm
Yes.
sorry.
and that is accurate.
So,
Many people call in for various reasons and can be supported and triaged and receive what they need over the phone. Many of those calls are resource-based, are individuals who have long-term illnesses and who need support. Some of those involve individuals who call every day at a certain time to just say, today I'm doing okay or not. So there's a variety of reasons people will call a crisis line. So the actual community-based dispatch is significantly lower than I think a lot of people anticipate. And again, I'd be happy to come back and bring some data and VOA to provide some information.
I'd like to maybe meet with both you and Kitsap Mental Health at the same time. That was what I was hoping for, because they have a different understanding of that situation, because then they get calls from the community going, why didn't you show up? We called this number. So that's what I want to make
And
sure
we meet with
is
them on a very
happening.
regular basis and would be happy to sit down together. Yeah.
I'd love to be part of that as well, if that's possible.
I'm just
Yes.
I'm gonna just remind ourselves what our role is there. We are policymakers.
Right.
Fun thing.
Yep.
And so I'm gonna look to you to come to me and tell me what we need. Okay? I might hear things and we're gonna ask you about it. And you're gonna tell me, yeah, that's anecdotal. The data does not support it. It's kind of like getting a grocery store in downtown Bremerton. We don't have the population yet, but we're close and we're so hungry
no pun intended, for that grocery store, you know? I don't know, we don't have an ad hoc committee. This is not related to our goals. I'm just.
Well, I'm
What are
feeling- we
doing?
do-
If it's a
we do-
Personal interest.
We do have a responsibility to make sure that when we're assigning public funds to another group with contract, we need to make sure that the community knows what we're expecting them to do and what the results are. So yes, I do think that,
That goes through the
I'm-
channels of staff.
I'm uncomfortable I'm uncomfortable with the way that things are going today because I feel like we have contracted them to deliver a product and they delivered us a product. And there's ways that we can partner. I don't know that I have any reason to not trust the data and the expertise of these folks. I think that I'm just uncomfortable with the way that today's meeting has gone. I appreciate
Well-
the services that you're providing and the data that you provided. And there's clearly a positive link in our community with this organization. I think that
Jennifer,
there's,
I don't think anybody's saying there's not a positive link.
yeah,
What
I feel like the aggressiveness at which you're treating our guests is inappropriate, especially as our
Oh.
chair today.
Whatever, Jennifer. I'm sorry if you feel that way.
Thank you.
It's not my intention. I'm just
Okay.
talking to our guests. It's not my intention to be aggressive with you. I'm just hearing from meetings that I've had personally with Kitsap Mental Health and listening to different community members. These are the questions that they're asking me. So I'm
If you're a
passing
public
those along.
entity, we are happy to share the information. All of our information, we are is publicly transparent, all of our data, and we are always happy to field. We do have expertise in behavioral health, particularly for the uninsured, non-Medicaid, and historically Medicaid populations. So for the populations most at risk, and are happy to provide any information and support to any of our community partners in that arena.
And working
Okay.
in this field, you must run across a number of people who get vehement and passionate about watching people die or die within.
This is challenging work. Yeah. We oversee substance use services and crisis services. So it is definitely an emotional place for a lot of folks, understandably. And that's why we do the work, because our goal is to support our community.
Thank you.
Okay, I
Thank you.
appreciate you coming. Thank you.
Thank you.
Go team prevent.
I'm ready for a break.
Thank you.
I need another new talent. No.
All right.
Agenda bill briefing number B, or letter B. Chance, are you speaking for Gunnar? I don't see.
No, Gunner's right out here.
Oh, he is? Oh, okay.
Gunnar is working.
Yes.
Okay.
And Brett, you're here for this as well? Brett,
Sorry, Gunnar, I didn't see you.
City attorney? Oh, I just couldn't hear you, I'm sorry. Okay, good.
Okay, Gunnar's gonna speak to the resolution to establish October 1st, 2025 as a public hearing date for the vacation of 26th Street. Managing Engineer Gunnar Fridriksson, go for it, please.
Good evening, all. This is a more of a housekeeping item. We have the neighborhood that we're looking to do on the 26th Street, and this right-of-way would have been vacated in 1896 because of a statute that the legislature passed in 1890. That statute was good for plats that were developed from 1890 to about 1904. The statute itself was revised in 1909. So there is that 14-year period where plats in this period in the county only, not city. So if this plat had been, if we'd annexed this area in 1895, the vacation wouldn't have occurred. But because this was in the county, it was for the full 5 years, it was an automatic vacation. It was just not something that was at the time with Kitsap County. It's not like they had people running around looking at these old plats and seeing where roads were and were not built. The road today is still not built. So we're basically kind of cleaning up this little bit of a road end, more of a procedural. You might remember we had a discussion with this in executive council a few months back. and then went to Public Works Committee here just a few weeks ago and brought it up again. So,
Yep, it was discussed thoroughly at Public Works Committee meeting last week. Okay. In number two, the rest of.
I have a question about number one,
Okay.
item A1.
Yeah.
Okay, good.
B1.
So I have a close attachment to this one because it was brought before the city, because a constituent asked me why there was so much garbage in that area, and I tracked down the parcel, and then a long legal thing went on. So my question is a few questions, but one is, when the question is asked, whether conditions may so change in the future as to provide a greater public use or need than presently exists, the response was there is no anticipated future public transportation needs. Well, I get that, you know, it's like a 1-block street between the inlet and what,
Finney Bay
Lafayette
Drive.
at Finney Bay Drive.
Yep.
So, but there could be a greater public use, except for the fact that later you say that there's a 30% drop, right? So you couldn't, like, it would be impossible to build stairs or ramps through that area.
Well, it's kind of a moot point. It would have been vacated. So we're really just kind of cleaning up something that should have been taken care of by the county 100 years ago.
Okay, so the people who moved into that area will get to keep the decks and parking that they
currently have. That's correct. That's correct. And we did work with them and talked with them. We do have a sanitary sewer main that was installed in 1974. And they have all signed easements for us, but once we get the vacation completed, then we'll go ahead and record the easements on top of it. So all of the city utilities are basically taken care of.
Okay. And on the other side, parallel to this, like if you ran a direct east-west line, there's another property that's be in the same situation. Will that also, like if someone begins to use that, will that also become theirs?
We've been kind of addressing these as they came up. The last time that it came up was in 2006 for North Wyckoff, basically from 26th Street all the way up to the water. And we are not actively looking for these, but as things come up and they come into our purview, then we go ahead and we just take care of it and clean it up.
Yeah, well, apart from the slope, which is 30% is pretty serious. One of our goals in our comp plan and our budget every year is looking for street ends to turn into public parks. So, but 30% is not going to do unless we get spider people.
Yes, it's extremely steep right off the start off of Finney Bay Drive. It's a 1-to-1 slope, and then it's it's
A
not
funicular, that would do.
right.
Okay, thank you.
Any other questions on this vacation?
Thanks for the couch.
So how should we treat this consent or general?
Consent.
Oh, you have to do.
It has to have a
It's public hearing.
Oh, public hearing.
Yeah, that's what we do.
We
Never
consent to a
mind.
public hearing.
We do.
The only question on that is,
Oh, we're taking action.
is October 1st just for staff time, or is it, just a couple general meetings between now and October?
It's we have to give 30 days in between. Yes,
Okay.
so we set the ordinance for the public hearing, and then we've got 30 days because we've got post notice and let everybody know what's going on.
Makes sense.
And
Yeah.
so just a single public hearing and then we take action, is that how this one's gonna work, or is there 2 public hearings for this?
It's well, you've set the ordinance, you'll set or resolution, I should say, for setting the hearing date for the public hearing, but we have to go to council twice.
Okay, so we'll be back again with this like 2 more weeks after the public hearing?
No. We go
Or next
next week to either consent or go to general business for the resolution for him to have a public hearing.
Okay,
And then he has
Right.
30 days and then he has the public hearing
and then we take action.
and then we
Then we
take.
take it.
That's
but
what
we
I
take-
asked.
Yeah, we take action next
same-
week though, too.
Just to announce that there's going to be a public hearing.
Right, I mean to pass a resolution is that the
Pass
action
the
is
resolution.
anticipated after the public hearing, correct?
Yes.
Okay,
Yeah.
thank you. Just clarifying.
Thank you for clarifying. Consent.
Can I ask one quick follow-up question, please?
Sure.
Once, should this vacation be approved, will, the owners of the abutting properties be responsible for maintaining hygienic conditions on the property?
That would be correct. They would become part of their property, yes.
Okay, good.
Well, that was the initial complaint, and it hasn't gotten better.
Okay.
Okay. Number 2 is resolution to establish October 1st, 2025 as a public hearing date for the vacation of the alley located adjacent to Lady Star of the Sea Church. Gunnar, would you like to?
Yep, and this is the same thing again. The church campus basically approached, or the school approached us. They're looking to construct a new building. As you know, they bought the old Canopy Kingdom property and the 2 houses that are there. They're looking to take the 2 houses out, build a new school building, but they had problems with the alley that was there. The alley was not really being very well utilized, and it does eliminate a conflict point for us on 6th Street.
Yeah.
So this one is kind of a no-brainer as well. We're looking to just go ahead and vacate that north half of the alley, and then the school can get going with construction.
Are they paying
Right.
for that land?
Correct. They are paying.
They're paying.
It's 50% of what the valuation is, which I think is right about $20,000.
So it's 20,000 even though they're a nonprofit? They pay taxes on that, or
They
how does that work?
they pay for the property, basically.
It's not our
a
job to
purchase.
figure
Yeah.
Nonprofits aren't exempt from sales tax.
Okay.
Okay, question.
Of property tax?
So will they also have to take care of removing the curb cut on 6th Street from redoing the sidewalk on 6th Street, which of course just refix them all, but
We actually coordinated with
or can that be part of their construction?
no, we coordinated with the group, and
They sell
it's
it.
already been taken out. So the contractor that is doing the 6th Street project took it out and
In
put regular curb
anticipation.
and sidewalk in, and the school is reimbursing us for it.
Okay, on both ends of the alley?
Nice.
No, just on 6th Street, on the street side of the alley. They'll take care of the asphalt and everything else when they do their building construction.
Okay. I like that answer. So they're paying for the property at 50% valuation, and then they're also reimbursing for the work done on the curb cut. Is that work done, meaning has that work been done? Or
It's been completed.
it's been
that's correct.
completed? Okay.
So why only 50%?
We have 3 classes of right of way. Class 1 right of way means we own it outright. We actually purchased it. We own the underlying dirt. Class 2 right of way means we've got an easement, basically a dedication, which is most of how we get our right of way. It's basically by plats. And then the third classification, or class 3 right of way, it's basically an easement. Again, it's been dedicated to us, but there's been no improvements made. So we have no money invested in it.
But it's asphalt. Did they do that asphalt?
No, the city more than likely did the asphalt. So it's class 2 right away with improvements. So that's why they owe the 50%. We didn't actually
Class
have to pay the property. We didn't buy the property
Okay.
to start with. We got it in an easement. So
So they're basically like buying the easement back from us, sort of.
Got it.
correct, and to a certain extent. Yeah.
That's a really good answer. Thank you.
All right, any other questions?
Nope.
Okay.
No
We're gonna
consent.
treat this
Public
as consent.
Another
Public
public
hearing.
But resolution consent.
The resolution.
We're consenting
consent
for it to
for-
be public hearing.
No, we're
Wait a
consenting,
minute.
we're consenting to
Approve the
the-
public hearing.
no, we're consenting to put a resolution on next week. We have to have a resolution for him to have a public hearing.
Right.
So next week, there's action. So we don't want it, do we want it on general business or do you
Consent
want it
for
on
the-
consent?
For the resolution to have a public hearing.
Yeah.
I think for both of them, yeah.
Of course.
Okay, thank
Wait,
you.
I think at this point in time, people need a break. Break, anybody?
I could,
I could use a break. So we'll come back at, thank you, 6:35.
It has never been cold in this room.
I know.
Why is it cold now?
We install fans
Hey, we're back in session. Welcome Financial Administrative Services Director Mike Riley here to present item B3 to approve the upgrade of budget analyst to budget manager position and improve salary at pay band 14 of the management, professional, confidential, and fiduciary salary plan. Financial and Administrative Services Director Mike Riley.
All right, that was a mouthful. Thank you very much. So I presented this yesterday at Finance Committee to give I'm going to give the headline. This has a zero impact to the budget. It has a zero fiscal impact to the financial services. Overall, the move you can see here for the position upgrade for where they're at in the pay band, the move to pay band 14 is $2,800 to individual. But with restructuring what we've done in the department over the last year, there is no financial impact. We actually can absorb this within the existing structure. We have those positions we decided to hold in the middle. We also reorganized a couple of positions. That actually is direct impact of it. So reason for this, a year ago, we had some turnover, obviously, in our team. We have a new city treasurer, we have a new budget analyst. You met both of them. Lauren Ellington is our assistant director, and Missy Gaines is in the position currently we're talking about tonight, is our budget analyst. She has, I've talked a lot about strengths. Anytime there's change, we identify the strengths of individuals and how they can best serve the city, best serve their skill set as well. We've talked historically with the city of where weaknesses are, and payroll is one. We have one payroll specialist in the city that serves over 400 something people, and they are the sole person that's pushing out payroll. So the redundancy there is light. So when I think this council was asking me, what do you need? I said, well, I need another payroll staff. Can I afford it? No. So how do you figure out how to create redundancy and strengthen the financial management and operation with have some resiliency? Well, it's taking those strengths and how we utilize the folks we have. Missy came in with a background payroll, background budget, and worked closely with HR. Those things all seem to interplay really well. So she took this on, actually, even she's already been doing this. We've already moved 2 staff under her. So the first one, we had reclassed our office assistant senior. I always get the title, I have to make sure I get the title right. That person, same pay band, but changed it to an accounting assistant 3, which gave it just a little broader what their duties are. They are a rover in our department. They back up payroll, back up AP, they back up customer service and on the utility side. So they can kind of move around where there's need and plug and play and cross-utilize staff. So that individual shifted under Missy, under the budget analyst, as far to be able to support that individual with her growth and exposure to payroll. So our payroll specialist, the second position, recently we formalized that to move under the budget analyst to support them. So they've been working really well together. They work very closely with Charlotte. So looking at external functions for the budget manager, you have that in your analysis sheet. Looking externally to some comps, some other logistic locations around us, and then internal equity. Really looked at internal equity or staffing. Met with Charlotte to kind of compare and contrast with that. So pay band 14 kind of aligns with our public works and utility financial manager. They have a similar skill set, yet the responsibility and duties are similar and vary. More of the budget manager, budget analyst has a broad view across all departments. We're public works, focused solely on public works and some of the data. So again, zero impact to the city budget. But here to answer any questions. In your packet, I did identify the pay schedule, so you can see it. I know it's always asked, can we see what the pay bands are? I highlighted where they're at. They're the top step at pay band 12. They would move up and 1 over. So again, it's $2,800 impact to the individual salary. Here to answer any questions.
Does anybody have?
So as mentioned, went through finance committee, recommended to move forward. The one thing committee, I think kind of requested just as we were looking at it, and let me say the kudos for streamlining and thinking about the redundancy, because as we know, challenging budget situation, this will not be the first for similar reorg we'll be looking at. But was to look at just the org chart, so we as a council could, refresh and know how each organization, starting with finances, flows on the org chart side.
That's great.
Yeah.
I did see that.
So before we went live, like Councilmember Coughlin, but Jeff at this table, let them know work today on trying. We do not have like one big massive chart that covers all divisions. What we do have in the budget and the document is by each division. But it's kind of nice to see how it all kind of lays out. So I will give you, you won't be able to read any of this, but I will send this out once I'm finished. I spent most of today,
And not was 24 hours ago. So
yes,
Yeah.
not, and not my skill set, but you can see what started is trying to bring everything together in Visio. So I will send this out once it's all done. They kind of list by department and kind of really get into public works. It gets interesting because you've got was right behind me, his division, you've got compliance and you've got stormwater. So trying to make sure you can see that too, what his groups mean that have some context. So I was trying to do that and didn't want to just slap some stuff together. I do have in the budget to kind of go over each division's listed where it has the executive and all the department heads, and then from below that you can see us like, gee, there's the police department. These are there. They're available. I'll send this out in the packet to the council just so you can have it. It is in the budget, but I believe that holistic view would be nice. Again, I was joking. I would like to roll that 40-foot paper out on the desk so we can really see it. And but it does show clarity and how we're structured because it's pretty complex. So
Good ask.
It almost looks like my genealogical thing on Ancestry.
it felt like it. I felt like
Where I
trying
should click and then a whole little.
Yeah, well, every time I move something, it all rearranged. So I was, I was expressing my Visio skills. They weren't great. So we're getting there, but I will send that out so you guys have that. I think it's good just to have as we even get in the budget and just have a holistic view. So
I really appreciate, I've said this on a regular basis, when you manage resources, when our staff manages that's what management is all about, or even a director, you're directing resources. And so when you can make a change like this, especially when there's no impact to the budget, that just makes sense. And I think, Missy has been in front of us, and I was very impressed with her during budget. So she came in and boy, did she hit the ground running. I thank you for spotting this, and, it's like continual quality improvement. Yeah.
thank you.
Michael, do you have questions? Anna?
Yes, thank you. Thank you for putting together that org chart, and thank you for asking for the org chart, finance committee people. That was great. It'll be really wonderful to see it, and I hope we can just have it as a hologram on these windows forever. Yeah, there you go. So I did have a few questions about this. This is called a budget manager position.
Yes.
But in the organizational impact section, where it talks about how maximizing efficiency on page, whatever, hang on, page 16 of our packet, there's no, it seems to be focusing on payroll. So why is it called a budget manager position? I'm not fully getting that.
Existing currently, with what we're doing, we're bringing payroll in underneath the budget manager, but all the duties still lie with the budget analyst that really is operating as a budget manager. The title has historically been the analyst. They are a sole office of one. In this city, we typically don't utilize the manager title until you're supervising somebody. As we all know, people manage things all the time. We've just historically kept that title out. They are, the level of responsibility of the budget analyst / budget manager, whatever you want to call it, is pretty paramount. As we know, to bring everything in. So all those roles still maintain. That's the office of the budget is office of two with myself and this individual. As we grow and have our team develop, as we talk about the rover that's in the office, there's some opportunity to cross-train some data analytics, be able to do some data entry into budget. It's not that accounting system isn't just payroll. They're there to back up in multiple areas, and they'll be able to do that as well.
So I'm gonna just turning to this council to say I'm gonna ask a few questions, because one of our council goals is greater community engagement. The budget is a big chunk of what we do. I'd like to ask some questions about this position and community engagement. So I'm going to do that, and then I'll keep looking at you guys, and if I see scowls, I'll start dialing it down. Okay. All right. Here we go. So, under representative essential duties and responsibilities, I'm requesting that you change city goals to council goals. Under reviews and analyzes departmental budget submittals for compliance with council goals.
Define that, I'll fix those in here.
It's the third budget.
Well, the
third
mayor
bullet.
has his own goal.
Yeah.
Yeah, it's not just a council.
Well, it is supposed to be the council goals that are transmitted from the community to the council and thus to the budget. That's the regular procedure in most cities. You know, we're the legislative policy-making branch, the mayor is the administrative branch.
I'm coming from.
That may
Question
be-
or,
Yeah, I don't know how that,
is it a question to them or asked to the group?
Well, I'm asking for it, but I'm not gonna keep asking for it if I'm the only one who wants it.
Well, to me, I'm reading this as the collective city, both the administration, council,
yeah.
and other,
Yeah.
and staff members. So I don't, you know,
Good.
it's like the royal we, it's the royal city.
Okay.
I appreciate that though, actually, kind of,
It's a good check.
Uh-huh, thank you. And will there be any emphasis in this position on engaging the committee? And I know that I know that when you came to my town hall, you did a flat out great presentation of the budget in plain language. So will there be any emphasis in this position on doing that?
point of clarification, you said committee, but I think you meant community.
Yeah, I did.
Okay.
So, we've heard loudly from council, that is the goal of council to have,
Sorry, I
more
had to interject.
engagement with the public. I'm working, hope to work with a return to your legislative, title.
Legislative
All things
office
awesome
manager.
out of this office.
All things awesome.
I think there's opportunity, to work with Ann, and also Denise. I've talked to with, again, our team of one or two, in budget, how do we ensure we're reaching the public? And so one of the conversations is with Missy and myself, is to sit down with Denise and have her come in. What can we do to engage that? The town halls I thought was a great opportunity. So how do we connect with Ann and connect with you to be able to connect with the public? I don't have the platform for me to invite the public into my office and sit down and have people, it's kind of an awkward thing, but really through the council, I see that's where our opportunity to get in front of folks. So how involved in your town halls do you want us to be? We're ready. I thought the meeting we had last year I enjoyed it. I had a lot of fun with it. Wish we had more time. We were kind of running over against it. It's more, the two
I
of
thought you kicked
stuff.
the football correctly.
Perfect.
Our
emphasis is already there, even without this position
Yeah.
change. It's already there. We've heard from council, it's one of your council goals.
Okay, my only other thing on this one is these are unusual comparables. If they aren't comparables that we typically use.
No, so more of a regional comparison. So we looked at internal equity within the structure of the city or where this job aligned. I would say we pull some comps in the budget manager. Where we're placing this is it's on the more conservative side. But we looked at internal equity against those other positions that they've in, and then work with Charlotte and HR to confirm it.
I'm not fully getting that. So the reason we're using different comparables than we use, like, I don't think I've ever seen Kitsap County as a comparable.
We
or
don't
Gig
have
Harbor.
So I did,
Am I missing something here?
I did,
I think what the issue is, for a lot of things we do, we're comparing whole departments. So there's cities that have whole departments. What they're doing is they're looking for the cities that have a department like our department. That's just said the same thing, I'm sorry. They're looking at like the entire police force, the entire city labor force, the Teamsters. They're looking at other finance departments, a director who has the same amount of responsibilities as their position. So they needed to find comparables for that position within a similar department. Does that make sense?
Yeah, so there wasn't one in like Lakewood
No,
or
it's
the.
much more vast. We did a broad search, and sometimes those positions are paid much higher with a team underneath them with different aspects of their job. So, thank you.
Yeah,
Thank you.
I have a question.
Yes.
Did somebody take a reduction in pay? Because I don't understand how we can raise one person's pay. And I'm not saying that, the position isn't worthy, but there's gotta be some sort of
Where do we
Where
find
the
the money?
budget. Yeah,
Where do we
where's
find
some
money?
money?
So I have strategically not filled certain positions in the last year and a half. So we still have those will likely be reconfigured or eliminated. We've also changed the allocations of staff that who they're serving. Instead of serving just, like I said, we're trying to cross utilize. So one position actually has half their time to support utility and finance, not just one. So even that position by itself more than triple covers this savings.
Okay,
So there's some significant things we're doing as finance, trying to do our part.
He's managing his budget.
So-
okay, well, that makes sense.
And it's labor to labor, so it's not, I even have some supply and services things that we've saved, we're saving about $90,000 on some bank service fees, but again, I'm not using it, so.
Okay, I appreciate that. It just
Yeah.
doesn't,
No, it's a good.
When somebody-
Great question. How do you add and where did you subtract? Yeah.
Magic.
Jeff?
Triggered. Okay. Just ask it aloud. Now, in the current budget, for future budgetary years, is the total amount of salary going to increase for the finance?
No,
Okay.
no, this is a non-structural change across going forward.
Oh, so
I think you can always say we can save it in 25, but no, this is.
I thought so, but I want to make sure. Okay.
No, good question.
Jennifer, did you have any questions?
No, thank you.
Anybody else have any additional questions?
Good job. Good work.
Thank you very much.
Okay. All right, how do you guys want to handle this? Consent?
I'm okay with
Consent.
that.
Consent.
Sure.
Thank you very much.
Thank you.
You're welcome.
Thank you, Charlotte.
Yay. Miss you.
Okay.
And there's the hot seat.
Oh, she's just warmed it
I
up
can
for
take
Dr.
the heat.
Briggs.
No. Perfect. I can't, so I'm gonna leave.
You don't mind that we.
Okay, we're gonna-
At study session, do you?
No, I love
Oh, I need.
I'd like to welcome Community Engagement Manager Janice Briggs, along with Mike Riley, to present item B4, which is to approve the Human Resources Director salary at pay band 21 of the Management Professional Confidential and Fiduciary Salary Plan, and approve job description of Financial and Administrative Services Director Mike Riley. And this is a repeat. Anyway, welcome, and let's hear your presentation.
Perfect. I'll tee it up real quick and I'm gonna handle a lot of it today, so maybe we can field questions. So, we want to get this in front of council. Obviously, the job description's kind of around to get in front of council and take a look at it. Kylie's out, this week, but we didn't want to wait a couple cycles to do that. So kind of how we got to where we're at. A lot of work went into looking at the existing job description for the HR manager, to look at current roles and some of the things we've heard from council, through some studies, things that we need to focus on, and then what a strategic planning to what's the right fit for the city. Again, I'll just go back. We did present this yesterday, but we just want to let the council know. What structure makes sense going forward as we have, again, a change. We have somebody retiring and it's time to look at it. Does this fit where it's always been? There was a question from council yesterday. I think, Jeff, you asked it, how many cities are structured with what we're proposing an HR director? I have that here. I'll pull it up in a second. It is much more prominent to have the HR director that resides under the executive of the organization. So I'll give you those statistics. So taking that job description, as we know, Charlotte is a working manager, is our expert in the field. So this position needs to have that, but also how they focus on the other things that a director needs to focus on with strategic planning and some of the things you see in here. So Kylie and Charlotte and others spent a lot of time crafting that. And then Janice, we brought Janice and myself in. I gave the hey, you guys did a great job. And Janice, with her expertise, says, hey, let's take a look at this. And how can we put this in, looking at our goals, looking at the things that we've been asking to do? How can we structure this job description to really target those areas? So as you read through the job description, you'll see both the kind of the highlighted sections. And I don't have them all, I can just kind of lean over what's important. One of the top things we hear is, really strategic planning and leadership. how are we gonna lead, how's this person gonna lead that department to the next chapter of the city of Bremerton? About talent management, labor negotiation, compliance administration, really putting those in buckets, and then underneath that, having sub bullets that really describe what the need is and what their focus is. So that's where we got, that's where we're sitting here today. And I'll jump in with some of the financial impacts. And again, we looked at internal equity. We have directors and where they fall on the scale. There's a comp analysis in your packet that was performed, looking at moderate, mid-range, against other comps. More traditional comps, like I said, for these, this kind of fits. A lot of organizations have a similar structure with the HR director. So right now it's about $20,000 impact to the financials. I'll just leave that with you. There is obviously a cost to this, but yeah, I'll maybe turn over to Denise for any highlights.
You said it all.
So maybe we're here to answer questions, but there's such a great nexus between Denise and this position and the lens that hopefully this candidate is looking through to bridge and mirror that relationship with Denise. And so
yeah. How was this process for you? How did that go? Reviewing the job description and.
It was great. No, I absolutely love the collaboration, even though I'm community engagement, and Mike is finance and Charlotte is HR manager and legal. I can see all of our skill sets just being woven together to say, as we think about the long-term goal for our city, for our community, what are those high-level things that we need to have in the job description? This list is not exhaustive, but what are the main things that our administration and city council would like to see the next candidate who will be in this role? Again, with an inclusive lens, of course. And so we worked together to kind of tighten things up. And again, there's some things that you might bring up that's not in here, but during the hiring process, we'll have an opportunity, whoever sits on the hiring committee, to ask potential candidates about their experiences in some of those areas. But we're here to take your insight, your feedback, and make this even more concise so that we're all on the same page before make the changes and bring it back.
Michael?
Mike, if you can remind me, you haven't had it in your department very long, right? Was it under legal?
So it's under legal now.
It's under legal now.
It used to be under financial services.
Oh,
And
okay.
prior to financial services, administrative services, and prior to that, it was an HR director.
That's all right.
So it is
Oh.
more from like 2000,
Right.
2000 to 2008 to 2000. It's changed.
Well, and we've grown. And yeah, okay. So that's reminding me about how also because of the legalness in HR, to have the HR manager or, be underneath, manager today, be under the purview or under the, the city attorney, then if something goes, it puts this, it's a weird relationship, and it sort of automatically gives like consent or, like implies consent from the legal, our legal. So it's kind of good to separate it out. But I would also say in lots of places I've seen, I think it was odd here that we didn't have it as a director. So I support this, and I don't really have any other questions.
Denise?
I think the finance director and the HR director are critical to the success of a CEO or a mayor. And that same level of expertise. And we keep talking about our staff and how important they are. They are our greatest resource. And so this position, I think, with the city of this size and the importance of this work, I think it's critical. I think I'm excited that we're now able and hopefully willing to move this forward despite the price tag. You're going to pay for what you get. So I'm definitely in favor of this. Thank you for the work on it.
Jennifer, do you have some questions?
Yeah, I think what I appreciate is that there are mentions of what I'm about to ask about. I'm curious, to me, what's important about an HR director is the ability to have like a cultural competency. Can you address that concern that I might have about our future human, not that Charlotte doesn't. Okay, I'm just saying like in the job description, I would love to see language around cultural competency. Can you, like touch on that for me? Either one of you, but I'm looking at you.
Yeah, I think that's crucial, and I think we can put it under talent management. As you think about your workforce planning, it's succession planning. We have a diverse community, we have a diverse workforce, different talents, different skill sets coming in. And so being able to even use a trauma-informed lens to help with any strategic planning and growth for the workforce is important. I think the cultural competency trainings were offered, I think it was in 2019. There's some historical trainings that have occurred through HR with that was exactly Brian.
Brian Marks.
Yeah, we're cultural competence is concerned. So I think
I would love to see explicit language.
yeah, we can do that.
In the job description. I want to look to council about that too, because I'm just one of y'all.
Unless it's said in some other way in here already.
That's what I was kind of looking for. Is it addressed in other language? But I don't know that it necessarily is. Feel like I would love explicit language around cultural competency. What do y'all think about that? I don't have the language for it. I feel like that's, Dr. I'm sorry. I feel like it's your area
For
of
some reason, it's easy
I'd
for
like
me to
Dr. Riley.
remember.
I know.
Heaven only knows why.
You're a doctor. That's what I call you doctor. I was the doctors in the house, and she knows. And she knows how to do the language better than I would. So I'm just curious if council is on board with maybe some cultural competency language being added into the job description. These days, it's so important. And also, I know that it's a tricky political environment in some ways, but I know that this does not violate any civil rights or whatever to add cultural competency in a job description. So.
Especially knowledge of and.
Yeah.
What
Right.
is cultural competency?
It could be
Oh,
anything.
let's not get started.
I can't,
What do you-
I don't know what it means.
I mean, cultural competency means like being aware of different religious needs of different, religions. Being aware of, if somebody is immigrated from another country, they may have different needs, things like that. It doesn't have to.
Backgrounds, communication styles.
Backgrounds, communication styles, ability to navigate somebody of, different cultures.
Yeah.
So.
I mean,
Well, and culture is, it could be socioeconomic, it
Yeah.
could be all kinds of different.
Somebody has worked very hard to not be in a box.
I mean,
Has been out and.
we all have a culture,
spoken to
yeah,
many different people.
we all have a culture. So I think, when I think about, and that's a very good question, we don't have to navigate it, and I'm not the professional in cultural competency, but what I know is that it is complex and there are best practices on how to navigate this complex field.
Is this something you could add, Janice,
Yes,
without
we can do
making it
that.
an extra page longer?
Oh, no,
Oh,
no.
yeah.
Just-
Okay, good.
we can just-
Even just knowledge of cultural
Yeah,
competency and being able to demonstrate their knowledge and what trainings, like you were mentioning in training. So,
I mean, HR, if something's a protected class and things like that, that's all, that literally is the,
yes,
their job. So
knowing,
the rest can be very up to interpretation, but.
yes.
But it could just be something like, manage the department in a culturally, manage the workforce in a culturally sensitive, something, but it's very vague to not get specific.
Right, cultural
Good.
competency is not specific. Knowing the laws around, protected classes is specific.
They're coming with that, I guarantee you.
Yes,
They have to.
yes. I think it would be interesting for a candidate to be able to even have an interview question that talks about, demonstrate your knowledge of cultural competency. I think that would
We'll
speak,
talk about it better than I can.
right, better than I can, so.
Eric, do you have
Market
any
account.
comments?
They probably are.
Oh, yeah. You asked me a question. No, I was just looking up cultural competence and AI told me all about it, so I'm all good.
Oh, good.
Okay, you're good then.
Well, what does AI say? I'm curious.
Good question. One thing that I didn't see, and maybe I missed it, is more non-traditional for Bremerton job recruitments, like more community engagement with Olympic College, with West Sound Tech, Bremerton School System. I'd like that worked in there so that people who live in the community also are represented in our workforce to a higher percentage than they are now. And I think we can do that by different recruitment methods.
Yeah, we can probably build on somewhere in there. And under the ability to, there's a bullet that talks about collaboration, stakeholders, and we can probably figure out how that fits.
I think under talent management or.
Talent
employee-
management.
Yeah, so because the HR director is overseeing the different staff, so then they
Right.
can decide, okay, come back to council, and say, these are our recruitment strategies for this fiscal year. We're gonna be strengthening our relationship with West Sound Tech, we're creating a pipeline, pilot programs, Olympic College, et cetera. So if you want it to be explicit, we can, but there's some language here about recruitment
I
strategies.
support it being explicit.
Okay.
Okay.
Yeah.
A
some of
job
the- some of-
description being explicit about the agencies that.
No, about the type of outreach,
Outreach.
that it'd be non-traditional outreach to,
Naming identified agencies, though?
No, that would
Oh,
be
okay.
naming them.
Yeah,
No,
we
just-
could
okay.
yeah.
Good idea, the concept.
And
Okay.
just for council, we do have an arrangement with Olympic College for internships. So we have a partnership with them. We've been working on that. Charlotte and myself have been building that out. It's a very
Nice.
structured program. It's not just, hey, put a flyer in the
Right.
the student union building. It's actually a structured program we've been working for the last 2 years to develop. We started in COVID, and as we all know, that kind of took a backseat, but it's active. We don't have a current intern in yet, but we're working closely with the person that heads that up. So
Are we paying them?
no, the interns,
Yes.
yeah, we can either be paid, non-paid, because they can also earn credit. There's a whole multitude of ways to do things. I thought you were talking about the relationship with OCM.
No, I didn't mean
Yeah,
that.
no, I got you. Yes,
Yes.
there's opportunity to do all that.
I know, because we've had great success with the intern that our department is using. So,
Also Grace Crowley.
yes, that was great.
No, we've been very successful with the interns we brought in historically outside of that program.
Very good. And do a second round of questions?
First round, okay.
Oh, I thought you had asked a
No, I
question.
have not asked any, well, I asked Dr. Briggs if it was okay to call her Janice.
Oh, well, that was your question.
No,
Sorry.
go on now.
Next.
So I have to admire the masterly understatement of Public Works leadership supports shifting the ADA coordinator role to the HR director.
Yes.
Oh.
I can imagine that they are reluctant but willing to serve the greater good in this way. Really, my question here is, is that a normal thing to oversee ADA?
In previous places that I have worked, HR has done that.
Yes.
Okay.
Traditionally.
And then the other thing is just bringing up something from one of the many rounds when we were trying to get this position funded and the job description and the search and everything. One of the things that we talked about was having the HR manager, was having your position supervise the HR manager. And I was just wondering if that was discussed.
This is a director position.
Right. Instead of elevating the HR manager to director, which Charlotte has explained to us why she never wanted to do that.
Well, that's just Charlotte.
Yeah, exactly. So I was just wondering, since it's something that came up several times, I was wondering if it came up in any of your discussion.
I don't recall that, but that was probably before.
No, I recall. I know what you're talking about. It was when we were talking about, how this position could be looped in and how they could be a manager, but, yeah, I do know what you're saying.
Okay.
So you're wondering if the discussion had been made, just for clarifying.
Yeah.
So I can kind of speak to that from the conversations that when we were talking about the engagement manager, and what role that would fit. I would say from that, the decision to move forward with where we went with the manage that and then separated the two conversations.
Okay. And Charlotte has approved every single word of this?
Charlotte has had a very impactful insight, and I think she's happy to maybe be as removed from it as possible.
Fair enough.
But there to support us as we move.
Okay, thank you.
Much like Public Works.
Yeah,
Happy to let go of.
happy to.
Why is she gonna be?
Oh, yeah.
If you don't mind, if I can add where we have a little bit of dead air there. Jeff, we did take a look across, government agencies across the state. There's 104. Wow. So
104.
Human resource director positions in the state of Washington that are government. That's from AWC.
They're reporting straight to the executive.
Yeah.
Well, there's 10 of them within the city of Seattle. Seriously.
The county structure obviously is not mayor, these are county and everything.
Right.
Yeah, okay, the top one.
Yeah,
Are they between departments, HR between departments?
no, it'd be the HR director for SDOT, the HR director for City Light, the HR director for public utilities.
Is there an HR director for SPEW? My favorite acronym
Yes.
ever.
Yes, there is one for SPU.
Thank
In
you.
fact, she used to be my union rep. I don't know how she got the job.
No.
Anyway,
All right.
Beth, you have another question?
But we digress.
I think more of
Just
a comment to say aloud, which is, I think excellent work on this, and it's to me the going from manager to director, the two things that really do stand out to me is that strategic planning and leadership, and the talent management. And I just want to say out loud, I liked that it specifically called out that the HR director provides guidance to other department directors and managers and staff development needs, and that doesn't say conflict resolution, but to that effect. And so I think it's just so valuable to have someone like that. And I know it's a tough position to be an HR director when someone has when an employee has, conflict with their manager or director or anyone along their chain of command or anyone else elsewhere in the city. Having somebody who has really good experience navigating that, while of course still protecting the city appropriately, but really being able to help resolve those and create a culture, long-term belonging and stability that I think is needed. That is just fantastic. So I think when we go to hire, having the focus on somebody, especially with those skills beyond all the core competency of HR management and all the knowledge, but really somebody who was a demonstrated ability to do some long-term cultural shifts, I think would really benefit this city.
Does anybody else have any comments, questions? Okay. How should we treat this?
Well, if there was some revisions that were gonna be made, right?
Mm-hmm.
So I really appreciate your participation in this. This is like, I don't know, this is what, yeah.
It's like the first.
I don't know, it feels like it.
Before council.
Is it? Yeah. Thank you so much. We are relieved to have your expertise on
Very
staff.
It makes us, it makes us feel a lot more confidence, moving forward. We feel,
I have to suggest.
it's more in alignment with our values.
Well,
Glad you.
I don't need it on general.
no, but
Maybe they
that,
can bring it to briefing.
we can, well, we have to, if it's the consensus of all of us to add something about cultural competency.
Mhm.
I was actually thinking of down under there, there's like in the ability to section, but the ability to operate in cultures. Hopefully competent.
I think the wording that I've seen in other job applications, other job descriptions is demonstrate knowledge of cultural competency. It could be as
I'm
simple
good
as
with
that.
that.
Yeah.
Yeah.
Something simple.
So we go to.
Under talent management?
Or under knowledge of.
Knowledge of
those
seeing
practices.
stuff,
Yeah.
We'll plug that in. I think it
Yeah.
was
Do you
two-
guys have
two
that whole
revisions.
sentence?
I'm okay with the incentive.
That was mine's done. So you had a revision?
The other one was the-
I had
the outreach.
revisions.
Yeah.
Outreach. Okay,
So those are
thank
two
you.
that I
Making
have
that more
listed.
explicit.
Yeah, more explicit.
So are we willing
So
to
we can
put it
do-
on consent and then we'll just review the packet?
Before the
If you
meeting.
can have these changes
Can
made
we
by Friday?
summarize the requested changes right now?
So the changes
What are the
are
changes?
outreach to the entirety of the Bremerton community, is that correct, Jen? Correct.
Yeah, we have non-traditional.
And,
Non-traditional.
and
Non-traditional.
Demonstrate knowledge of cultural
And the cultural
competence.
Yeah,
There we
so
go.
just those two, yeah.
Yep.
Easy peasy.
So then it'll be everybody okay with it being on the consent calendar?
Yeah,
Yeah. And then we'll see those modifications
Yeah.
on our packet Friday afternoon,
yeah.
Perfect.
okay?
Yeah.
All right,
Yeah.
thank you very much.
Well, thank you for your leadership.
Oh, thank you,
Thank
Dr.
you for the
Rose.
hard work on
Thank
this.
you for
Thank
your
you,
leadership.
Ryan.
Thank you, Mike.
Charlotte and I appreciate it.
Boy, what have we here?
I know, it just popped up, didn't it?
What's happening? What's happening? Oh.
So here,
Yeah,
I can pass out,
there you go.
Thanks.
just so you got it.
Want me to pass
on
the
there.
rest out?
Yeah,
Yes, you got it. Oops, sorry.
oh, sorry. Okay. Next up is item B5, an ordinance to amend the Bremerton Municipal Code, chapter 3.78, entitled Multifamily Tax Exemption. And I will be presenting. So, let me get my notes, please. So the state of Washington legislature has written and modified a bill numerous times for a multifamily tax exemption. Of course, they haven't funded it at all when we exempt these taxes. And we have, in our growth management needs, where we had to modify our zoning to meet the needs of the goal, where the city of Bremerton has to increase our population, or the goal is 46%. The UGA is 27%. The UGA for Bremerton. Silverdale, they have to increase 50%. Bainbridge Island, 18%. Kingston, 131%. Port Orchard, 67%. Port Orchard UGA, 23%. Polsbo, 38%. Central Kitsap UGA, 20%, and rural areas, 5%. So we all know it's more expensive to construct new buildings where you have to knock down an old building. And so developers are building apartment buildings like crazy out in Silverdale and in the more rural areas of Port Orchard, but it's much more expensive for builders to build within the city of Bremerton limits. So with that, the council had decided years ago that we should provide some incentives. So currently, the incentives were that you could get an 8-year tax exemption, and the only tax that you would have to pay is what the property itself's value was, the land. There's also a 12-year, currently, there's a 12-year exemption. And for that, there's a 20% requirement of affordable housing. Unfortunately, the affordable housing isn't based on what the city of Bremerton's median income is. HUD determines what it is, and they make that determination by adding together the average incomes of Bainbridge Island, the urban part of Silverdale, the urban part of Port Orchard, and the urban part of Bremerton. So it's more than 150% of what Bremerton's AMI is. Constituents, residents of the city have complained that the affordable units aren't affordable to people living in Bremerton. So our committee, which was Council President Younger, Denise Fry, and myself, met and had discussions, and we feel there's a compromise that can be made. It doesn't reach all of my goals, and I'm sure it doesn't meet all of President Younger's or Councilmember Fry's goals either, but it's a compromise that we all agreed on, and we hope that the rest of council agrees with us. And that is to no longer having the 12-year exemption, and there will be no modifications of adding on additional time like we currently have in place, and only have 8-year tax exemptions, period, and only for rentals. It won't be for properties, especially, well, it won't be for properties that are sold to high-end and used as a marketing tool. So
I don't even know what that means.
An example.
it means there's buildings that currently are getting an 8-year exemption that are for sale for almost $600,000. And they're using that as a marketing tool that you don't have to pay property tax for 8 years. So that's why we went to rentals only.
So
You're
the,
talking condos?
But
the
you're saying
condos are,
somebody built an apartment complex. Does this cover condos?
They're condo.
Not anymore. I mean, the proposal is only rentals.
But it could be, I know what you're getting at. The condos themselves could be rentals.
Okay, I'm sorry. Currently, can somebody build a condominium building and take advantage of
Yes.
the MFTE?
Yeah.
Yes,
So, but condos aren't rented at a monthly rental rate that would.
that's why we're modifying it.
Condos are,
interesting.
but have any, okay,
We're
next
proposing.
question.
Yeah.
Have any condominium projects been built in the city of Bremerton that are using the
Yes.
MFTE?
Yes,
Which ones?
The mentor ones.
the ones right as you go up the
The
Warren
Claire.
Avenue Bridge,
Up at Claire.
the Claire. This
The
big,
mentor family,
big
the mentor
brown
property
ones.
where the old sign was.
Do you mean those big tall ones by
Yes.
my shop?
yes,
Oh,
Right as you-
wow.
I
So
think
how
they're
do
called
they-
Claire.
How do they calculate? That's weird. Okay.
600,000.
So the proposal in the new ordinance is that they would, properties that are being sold to individual owners would no longer be receiving the tax exemption. It's just
Interesting.
for apartment buildings that are renting out units.
So putting a positive spin on it.
Mhm.
I almost wore my trust the process sweatshirt tonight, but it was too warm today.
I can imagine you wear a sweatshirt.
Because I really was struck by the fact that this small committee who came together and with different perspectives on this, and probably Vice President Revelowski and I had the most disparate perspective on it. I felt pretty protective of the MFTE because I believe that it has built a lot of multifamily housing that we desperately need. But I also understood Jane's concerns about it. And I think a couple of things happened. One was Soundwest applied for the 12-year extension and got it. And then the owner occupied, is starting to be used and that just kind of pushed it. Like, wait a minute, what do we really want this to do? This was never meant by the state to be a truly affordable housing program that was written in later. So multifamily housing is more affordable than single family housing. Building it, one reason we decided this, and we came to this, Jane and I didn't really sit down and talk about it at all. We went and talked to other people. She talked to her people, I talked to my people. And there was an article in the Kitsap Sun that showed a lot of information dumped for the community. I just thought the way it came together, and then we walk in for our last meeting Jane and I sit down and we're saying, we think we're a lot closer on this.
Yeah,
than we
Eric thought that, he's like, I'm gonna suggest something and you guys.
Yeah,
are gonna-"
he thinks
you're
he's
both
gonna,
gonna
he
hate it.
thinks he's gonna put his mojo magic on us, right? And Eric, you're still there, so I know you're grinning right now. Yeah. But he saw it. He saw it. He saw that we were, really in alignment. And this is the best for Bremerton right now. Maybe the MFTE, the way it was written before and adopted, was best for Bremerton then. I don't know, but I think all three of us are in agreement that this is what Bremerton needs now.
I really appreciate that our community development director helped us craft it too, to be the most fair for the community too.
Yeah.
So, I mean, I would love everybody to pay property tax. Taxes are the cost of living in a civilized society, but if this is the only, pardon?
That's fine.
Wait, I'm the only commie on
Yeah.
council here. Come on now.
All right, sorry.
But,
Yeah.
we have to spur some development and it is more expensive to develop here. I would love for there to be a sunset. Currently, there is a sunset in the state law.
We'll see what happens.
We'll see what happens because every year they change the laws. Every
And we
year.
might be built out by then.
Hey, we only
Stuff
have
will
to,
be happening
we
in
only
my
have to
district.
build for 19,000 people and I think
Well,
we've built for at least 2,000 already. And we got 20 years to do it.
Yes. So, just really quick question. The reason the definition of low income household is in here is so that later at the top of whatever it is, section project eligibility, when it's talking about relocation assistance, that's the only time that the phrase low income household crops up.
Yes.
I think that you guys did a really good job. And kudos to you. I know you're not drinking anymore, so
Yeah.
that's a bottle of champagne for you that I'm
pouring out of
saving.
Nutella.
Yeah.
Yeah.
I will get to you the Nutella.
And the 8-year by far was the most popular. It was the most popular.
Yeah, hardly
It's
anybody-
what it was meant to do, so
Yeah.
trust the process, people, it works.
Great. Eric, do you have comments on this?
Well, I think you two, Jane, you did an excellent job presenting the issue, so I recommend you do it next Wednesday as well. Unless this goes on consent, I would imagine you'd put this on general business to make it known. But
I'm happy to have this on consent.
well, okay, whatever the council decides. But Denise summed up. I went into the meeting, thought I was gonna have to strike the great compromise, and I started my routine like I do, and they both looked at me and said, "No, we're in agreement. Just the 8-year, it does make the most sense. It's saying to ourselves, okay, come on, this really isn't about providing low income housing. It's not effective. So what is it? How can we help our developers? The 8-year one has been far the more popular, the 8-year versus the 12, and no one liked the extensions to the 20 or having an 8-year project and being able to take advantage. I won't say take advantage. To re-up and do a 12 on top of the 8, and no one liked that. That didn't sit well. We've had people come down to council and complain about that. Is everybody going to be happy about this in the public? No, I can think of one person that's going to be upset. But really, this is a good balance, and that recognizes that we still need more housing of even this housing, which is not going to be low income, but we need more housing in the city of Bremerton. We need to provide incentives. The state has given us this tool to do this. And if we don't do this, other communities that will use the program. So I think it's a valuable tool in the toolbox. So I'm grateful that we reached consensus, at least the committee, and I'm hoping the whole council agrees as well.
And Michael?
So, I'm often concerned with unintended consequences, and there were unintended consequences that we set in motion years ago. I did not know that you could do a condo, and anyways, so I all for taking out the owner occupancy, which is so funny because a lot of times you see like first time home buyer owner like benefits and things like that. I'm 100% with this 20-year or the extensions. I'm good with that.
Good with them going
Good with them
away.
going away. Good with them going away. So yeah, I think that just folks who have looked into it a little deeper, you know, that's still a concern. And I was glad to hear Eric just acknowledge it again. Like, obviously, we have these growth targets, and you know, I guess I'm curious as to when we look at the 2,000 roughly that we built and the 20 that we're trying to get to, how much of that was from the 12s or the 8s? Do we like? I
I don't have the chart, but there was
Well,
hardly any that were the 12s.
under the 12s. Okay,
And none of the 20.
like my big feeling on this time that, you know, since we brought it back up has been like, this is a tool we have to build housing stock. Okay. Yeah, it's maybe not the best for affordable housing, but I was kind of like, why aren't we working on other things to get affordable housing or things like that? Why are we just worried about taking a tool out of the toolbox and throwing it at that noise out the window? So I don't know if you have a little more, if you can offer any more depth on if you've a little more than just like hardly like about meeting our targets, you know, we often talk that there's not much we can do for affordable housing or that, but this was one thing that we could do that the state allowed us to do. So
But it didn't really
But
produce
remember-
affordable housing because it was based on HUD numbers that average in
Yeah.
city of Bainbridge
I
Island.
think one of the things for me is, I think that, I know people don't, you know, will scoff at this, but like, you know, if we build too much housing, the price goes down. The reason prices went up so high is because there just wasn't enough housing, and people are moving here because it was more affordable. I mean, it's just we have to look at all the reasons.
Well, there's more than that too.
Yeah,
You know.
yeah.
So 300 units up at Rydell
Mhm.
are packed full with
Yeah.
a waiting list.
Yeah.
You know, and it's, when we looked at the rentals, the rental charges, the units up at Rydell are looking like the affordable rates weren't that different.
Yeah.
You know?
Yeah, when we averaged that in, it wasn't.
So
Yeah.
we're kind of just thinking like, here's this, you know, take advantage of the 8, don't pay the taxes for the 8, build housing. Don't worry yourself. Don't worry your pretty little developer deep pocket selves with like creating affordable units that aren't really affordable. Like,
Well, you know, there's also other tools. This whole census tract, which is all of downtown, is an opportunity zone, right? Federal opportunity zone, which they just made permanent.
Right.
So that has huge tax incentives also for investors in it. So you would think that more of that money would be coming instead of, you know, looking at an empty Eagles lot with weeds growing out of the foundation. But, yeah, the affordability has never been there, never has.
Not the true,
So-
not in the true.
But-
80% of AMI is.
But it's the AMI that HUD
And then-
determines.
Right.
I'm feeling pretty good about this, just so, but what about like, and I'm looking to Director Spencer sort of under it, about like, are there many things, like, when does this go into effect? Are there things in the pipeline? Are we gonna, like, is there a way, I don't know, I don't want to screw up some housing that might be in the works or something.
Are there any housing?
Is there any,
If a project has an application in today, they're grandfathered.
Okay.
So all the projects that we're anticipating using, we have applications in. So this is irrelevant to, other than the ones that are in the pipeline that we don't know about that haven't made an application.
Yeah.
So, but the council, it's up to you when you make the effective date. If you wanted to delay and make it effective January 1 or whatever
Okay.
you want to do, you're in the driver's seat.
All right.
So you can make it effective, but we have lots of applications in today that our
We're nervous about more 12-year application
yes, extensions,
and there's some of those that have come,
that have already come in.
that are already.
see?
Well, I'd like to make
That's
it,
why I wanted.
I don't know,
Effective
there's a piece of
ASAP.
me that says, this thing seems to be working, or I don't know, or maybe we're being taken advantage of. I don't know.
Affordability didn't seem to
The
be.
affordability,
Michael, can I comment on that? I saw Jeff.
Yeah.
So, Michael, I really see this as being a housekeeping issue. So the council's had a chance. First, we had the 8 and the 12, and then we tinkered, we add more to it. We've had a few years to see how all it works, and then we saw, and it's logical, developers took advantage of some loopholes that the council and the public aren't too pleased with. And so the marketplace has told us that by far the most popular is the 8-year. And by just having the 8-year, that means, okay, we're willing to give the tax break, but it's only for 8 years. And then it goes back on the tax roll at the enhanced value, and they start paying taxes on that building. So to me, the marketplace has already said, I want the 8-year. And we're just closing the loopholes that we see about, these high-end houses getting the exemption and developments taking the 8 and then tacking on another 12. And it's not really providing what I think most of us see as truly affordable housing. So we're just closing those loopholes off and keeping the program.
Jeff, did you want to go next?
I just want to say,
Oh.
thank you. I'm on board, and not because he mansplained it. Thank you.
I know Jeff had his hand up, so I'd like to,
No,
after
thanks,
Jeff.
appreciate it. Yeah, in return. One small question, then a bigger one. The small one was, the project still have to be located in the target residential areas, right? 'Cause I
Yeah.
see it was that's still in project eligibility, but I noticed that was struck out under the application for conditional certificate by the director.
What page is that?
So that would be,
What item is it?
of the packet
Are you
36,
gonna
so.
finally come up to the table and talk to
For
us?
you.
Hey, 3.78.070, item 4.
Yeah, so that was just a housekeeping measure that when we change codes, I try to go in and do other necessary housekeeping measures. So the application, that section just reiterates what the requirements are, and it's just a redundant section. And that gets a little weird in that it lists out the requirements and then says the director may approve the application and then it lists out the requirements again. So that's just been stricken. If the application meets the requirements, it'll be approved.
Okay, and the target areas are still in the requirements. Okay,
Correct.
perfect. Okay,
Under the project eligibility.
awesome.
What's the bigger question?
The bigger question is I'd like to hear from each member of the committee why to completely eliminate the 12 and 20 year instead of what had been discussed previously, which was to scale that AMI down to,
Right.
use the Bremerton factor, to ensure that if any units were created, it was truly affordable housing. And so why eliminate it completely instead of just scale it down?
Because the council discussion we had when I was trying to get a moratorium in place, there were several members who didn't want to use anything but HUD because they felt that was the only way you could actually tell somebody's income by pay stubs. And they didn't want to go with census data, which is what.
Self-reported.
I'm saying
Well,
whatever,
it's what you tell the federal government you're making every April 15th.
to clarify, whatever source of the median income is, there's the option to say, we're gonna set it to 70% of that or 60% or half or whatever number. So why not scale?
Because we've had what, 2 projects that have done the 12-year. That's it, right? Is there 2 or 3?
There was also significant concern over the amount of staff resources needed to review those reports. I think it's every month, maybe they have to be submitted for compliance and annually. Okay, that's not so bad then.
Chase the data down.
We just didn't see the cost benefit ratio wasn't there. And then it was hard to find the affordability. It wasn't that far below what the market rate.
In some places, it's
Yeah.
actually cheaper to go rent out at Blue Ridge than an affordable apartment under the 12-year.
So, right, to reiterate, if the factor was applied, it would ensure that those affordable
20%.
units would be truly affordable. Now, whether it, pencils are not out or not, so that anybody would take advantage of it, right? It's a
Well,
tough
the
analysis
HUD
to
number
ask
goes
for.
up every year, so every year we would be revisiting it.
Hey,
Do you
Jen, you asked for all three committee members, so you're ready for my answer?
Yeah.
So my answer, well, one is the marketplace I doubt they would take advantage of the program if we had it in there because the rents would be so low. But the biggest one, and therefore your profits would be much less. I'm not sure what the delta is, whether they would do that program or not, but the marketplace has told us probably not. The biggest thing by almost everyone doing the 8-year anyway, the biggest thing for me, Jeff, was I wanted to offer this on an 8-year and then get these properties back on the tax roll. I don't want to offer on a 12. I don't want to offer on a 20 because I think there's much more bang for the buck for low-income housing in a different program than this. I would rather say 8 years onto the tax roll, and that's how simple it is for me.
I agree.
It would be a
Well
really
done, Eric.
expensive way to provide affordable housing. It has been a really expensive way to provide what we hoped was affordable housing. My question is, how do we stop those 12-year extensions?
Oh, the extension?
You can't stop the ones that have current applications. Those are
Once they've applied,
It's grandfathered.
we can't stop it.
You're talking.
That's why we needed the moratorium.
Oh, we're talking about extensions,
Yeah, they can still,
but do they have to convert to affordable housing units?
Yeah.
Yes.
Well,
Because
but
it's safe.
no new ones could come in.
After
Once
this-
this passes.
after this passes.
So
Right, so
let's
it's-
pass it as soon as
and they don't-
possible.
But is that at the director's discretion to approve?
If they meet the criteria.
Yes,
it's
she's
already
got
in
to.
place At the time of application, we have to approve it.
So, may I? Yeah, okay.
Sure.
When you called for the moratorium, that was how long ago?
It was May.
Were,
Yeah, May.
were any other extensions brought in afterwards?
One applied at that time.
Who was it?
It was in progress when you were first starting to talk about it, so.
In progress, meaning it was,
In development, it was getting submitted in here.
Like pre-development.
but,
It's-
Okay,
it's an
okay.
extension, so it's the 606 project down here.
oh, yeah. Are they a hotel? Wait a minute, are they the hotel?
No, the 606 is the one that sits on top of
I
city-owned
know.
land, so they pay zero taxes as it is.
I just want to check in with Jeff to see if you had any recommended changes you wanted to make to entertain with us.
So if you not negate, I think it's a good consideration on the extra staff time in Eric's argument. If you just set those aside for a moment, there is an argument to say, keep if we really want affordable housing in the city, which we desperately need, there's an argument for keeping the 12 and 20 year with scaled rates that are truly, let's say, affordable, right?
What's the
And
percentage?
They won't.
And-
allow-
Hold on a minute, I want to hear Jeff, hold on.
Yep, thank you. I did not finish the. And having it on the books now, if folks are convinced, as I just heard a lot of people say, that no one's gonna take advantage of them, then they don't want to take advantage of them. If someone comes along and says, man, my project, for whatever reason, does work out with the 12 or 20 year, and they do create 20% of long-term affordable units,
Okay,
then it would be a good thing we have that on the books, if that's really what we want, is to make sure that we have set aside affordable units in the city.
so what I hear you saying is an amendment you would like to see made or to entertain and discuss is
considering keeping the 12 and with the extension.
I'll say I'm not proposing a minimum. I'm putting that item for discussion, right?
Okay,
That's kind of my
okay.
question to the committee. Of
Perfect.
why eliminate it entirely instead of scale down? Because that haven't talked about.
And we have the ability to set whatever percentage we want based on the HUD. We can
Right.
say, which is what was brought to us in
Right.
Finance
We could
Committee
say-
3 years
we could
ago,
say
right?
You have to have 20% of units, and we could scale it so that it effectively is $1 a month, right, for rent. Right, now, no one probably will take advantage of that, but I'm saying, right, we have that ability to.
What the developers in Seattle are saying now, and I know we don't want to be Seattle, but we should take lessons from what's going on, is that once the city brought it down to a much lower percentage, the developers could do it. Those projects wouldn't pencil
Right.
out, which, as you say, would then
Yeah.
self kind of, but I don't want an overzealous. And here I am, I understand developers' perspectives. I don't want it, oh, I'm gonna do this great thing, I'm gonna, have this 12-year extension, affordable housing, and then realize they can't do it and make money.
How is it worth an extra 4 years too? The thing is, you can't build luxury affordable housing, right? It can't be done. Department of Commerce grants allow our community partners to leverage Department of Commerce grants to buy land cheaper. They can go work with groups that might sell them land a bit cheaper and build at a less cost. Then, affordable housing usually is housing that's been modified, like the Frank Chop House. That was the old hospital, and they modified that, and they were able to make those into affordable units. You can't start from having to knock down the Eagles Hall and then build 20% of your units affordable.
In this market.
Not in this.
Well, but they built 2 projects in West Bremerton, brand
With the
new,
8-year.
With the
and then,
8 year.
and then
With no
sold them,
intention.
and then sold them to the housing
Oh,
authority.
With
that-
Department of Commerce grants.
Okay, but,
With Department of Commerce
Yeah.
grants is
Well,
really an
I
important.
understand.
And that's like,
but I guess what I'm saying is, why couldn't an agency get a Department of Commerce grant and build something? Because you're telling me you can't build affordable housing.
I think the ability to build affordable housing is a separate discussion.
Yeah, I feel like you're off track there.
And Jeff, the community has been really, really good about making things clear to us when they don't like it. So I think Denise has talked to, am I correct, like the development community, and Jane has talked to other communities, and everybody seems to be okay with this. So I don't think we should be looking for trouble. Like, because you're right, it's possible that like somebody will come along with a genius 12-year plan. But it hasn't happened, and we can't.
Can we get in the
and then we,
packet again, the list of current MFPs? I know it's in our email and bits and pieces, but.
People who, or the
Right.
Property tax that
project.
we're not getting on account of it, because those are persuasive figures.
That's not what I,
Oh, I'm sorry, I keep interrupting.
point of order on tone, please.
Sorry.
Is it worth another 12 years of loss of tax for 20% that may or may not be less than workforce housing?
I don't think that you have a buy-in, but I wanted to entertain
No,
it because
yeah.
I appreciated what you were saying.
Right, it's a discussion we need to have, right? And hopefully we'll
Yeah.
get public comment on too.
I think we
So-
had it.
Yeah.
I think we had it before this ad hoc committee was established. I think we talked about all this, the first presentation was made. That's what fired me up to begin with. And then this ad, so those things were taught, I remember us talking about all that stuff.
May I ask just a kind of a final question, just of the folks here? Is it a benefit to us to have public comment on this and wait another another round so we can bring this back to study session for further discussion? Is it a benefit to anybody?
Why
to
can't
that?
we discuss, why can't we put it on general business? Let
Yeah.
everybody talk and then
Yeah.
we get to talk
Yeah.
and vote on it.
Just like.
I just
always.
wanted to make sure that there wasn't any lingering data that would help us inform, that would help inform us that, okay, I'm okay, I'm great with
Also
this.
really, as a member of an ad hoc committee, that ad hoc committee did a lot of work on this. You know, we met a couple of times, Eric was on that, you know, we put our pedal to the metal with that.
Research for us.
Yeah, you
And
did.
For us, it's almost like, what do you mean we had consensus of this really diverse
I don't want to
committee?
negate that at all.
I know,
But I have to
I
ask
know.
the questions
I
because it
know you
wasn't made
do.
part of the presentation, right?
I'm,
If the part of the presentation was, and we considered this, wouldn't ask the question, but I. but it
Then
wasn't.
make that part of your presentation.
You know
next
what?
week. I will.
and also, I know, knowing Jeff, he is already constructing his reply
Yeah.
and he'll have some points for us for consideration, and that's what I appreciate about
And
it.
I'm sure we'll.
They deliver
About
information.
the MF.
Maybe not. Okay, no, it's good, this is good.
No, I.
Because unintended consequences.
Exactly, right? I hope everybody listening knows that the entire goal of this council will make sure we're in a housing crisis, right? We're to have affordable working class housing.
Yes.
That's the goal. The only discussion here is the best way to achieve it, and we're down to a very picky part of it, I'd say, which is,
Mhm.
yeah.
Good
Well,
progress.
I'm kind of curious why, you know, it was, I believe, 3 years ago that it was brought to at least
It
some
was
of these
right as I
council
was coming
members
on to council.
to do
Yeah.
that, to try to
Wait, it was,
scale it
it was
down.
brought to council. It was brought to council and it was shot down based on the proposal that DCD gave us. And we were in agreement with about a couple of points that had to do with I'm trying to remember with remind, because we did, it was brought to council, 60%.
The piece I was gonna add, might fill in what you're about to say, is there were so many moving pieces that we were trying to look at the same time.
Mhm.
To do it, to not do it, to change this, to change that, to use this data, to use that data.
Yeah.
Like it was.
I think this simplifies it.
It definitely simplifies it.
It was sent back to finance and we talked about it again and again.
So to the,
And I think this simplifies
what
it in a actually pretty eloquent way. So thank you very much for your work.
what helped really move me on this was from where you're kind of bringing up, because I was really, even when when Shane started, I'm like, I don't know about the 12. It just keeps it simple. And I'm kind of all for doing this. And then maybe putting our heads together and say, is there some other way we can offer a tax break for real affordable housing?
We already do.
Nonprofits don't pay any tax.
Most nonprofits.
And they're the experts in providing it.
Or incentives for chronically vacant buildings.
Peninsula Community Health is property tax.
I gotta give it to you with this one, Councilmember Rebelowski. I mean, I look back, when you do a Google search on this issue in Bremerton, Jane's name comes up a lot.
But I ran
Well, before you ran for
Before I ran.
office, you were writing in about this, and I just want to say thank you. Because, when you first brought it up, I was like, oh, damn, don't bring that up.
I remember.
I'll second that.
Yeah, but I'm really, really glad that you did, and on the other end of that continuum, I'm really glad that you're challenging it too, Councilmember Coughlin.
I didn't think I'd be where I was
Yeah,
at tonight.
good.
And I'm,
I think it's really great to serve on a council with members whose opinions can be changed by evidence.
No, I really appreciate everything I said from day one, 2022, when getting on there, right?
Yeah.
We needed a really thorough analysis, discussion, as to Eric's point, we heard a lot of moving pieces on this, right? That's what I was arguing for back then was, hey, right, and it goes to you said, we can't as a city be changing our mind every other year, right? That lack of stability is a problem when we want to have housing in the city, because we need housing in the city. So I do appreciate, honestly, the deep dive and what we really needed for a long time, which is really digging into the data on this. So absolutely appreciate that.
Anybody else have any other comment?
General business, let's go. Finally, an agenda with a general business item on it.
Hey, whoop, whoop.
Does everybody want, go for general business?
Yes.
Okay.
Well, do you think it doesn't seem to be any point putting it on consent.
No,
No,
This is a
this is too.
large piece of legislation.
Yeah,
yeah,
Okay.
needs to be general.
yeah.
And
Okay.
and if I could, neither Garrett or I can be here next week because we're away at conference. So if there's something that you need, you need to know.
I don't need anything.
I figured you had it covered, but I just wanted to let you know that neither of us will be here.
Okay,
Have a good conference.
thank you. All right, I'm gonna provide, well done with that issue, right? We're on general. I'm gonna give you a brief summary of our last Public Works Committee meeting that was held on August 19th. Dave Powell gave a great update on the East Side Treatment Plant, UV replacement, everything's going good. Matt Donley-Cott, presented the purchase of a F-750 truck, which is a multi-purpose truck. The vehicle purchase was originally approved in the 2022 budget. They couldn't get it because of supply chain issues. Mike has answered the community questions of whether or not we can use money that was approved in 2022 now, and we can. Quincy Square, I think you all know that it's closed to traffic Friday afternoons through Monday morning. Nick and Ty will be coming to our meeting, I think. The first meeting in, the first study session in September for the acceptance of the grant funds for the 6th Street Active Transportation Project. He also announced the date, and I can't find it, for when the next public meeting. I'll edit it on September 30th. September 30th, for the public, there'll be an open house at the Norm Dix Government Center. There was a resolution to modify parking on Elmira Drive. That's kind of a housekeeping thing. There's a private apartment building that's using public land to park on. And with this new project, they're gonna have to modify the way the parking is, so they're not running over our kids.
For that.
I know, I was for that too.
I support that too.
So,
Since it's a safe route to school project.
yeah,
Yeah.
it's almost like a park. You got bike lanes.
I'm
Park
looking
like
at it that way.
Park-like features.
Mark adjacent.
We're getting a couple, or we're applying for a couple stormwater, ecology stormwater grants, which are really helpful. Believe those are no match grants.
Chance typically gets those.
Yeah. Yeah. Oh, one of them has got a 15% city match, but it's only a $297,000 grant, so we're talking 45 grand, and they have the money in the budget for it. Gunnar presented on the 2 vacations. And then we had a discussion on the Transportation Benefit District funding discussion. And that is going to be on our next study session. I'll be presenting on that. We had a long discussion on the luminaires. Who picks them? Who buys them? Why do they take so long? Why don't we buy them in advance? It was.
I don't want to just use
I
washdog.
I know. I'm happy if we use wooden poles as long as they just got put in place.
Trash cans with fire.
Because we like to
Yeah,
decorate.
we
We
do
want
that.
to decorate.
Yeah, but it's too much. I mean, we're over a
Yeah.
year behind getting them on 11th Street.
And it's dark there.
Yeah.
Capital project updates. We briefly touched on the Warren Avenue Bridge. There's an open house coming. There isn't a date for that yet.
It's all good.
Yeah, no detail on that yet. And let's see. That's about it.
About the equipment, that snow plow and all of that.
That's the F-750.
Oh, that's right.
Yeah, it does a lot of things. It also, they bought an attachment for it so we can pick up 3 yards of concrete at the plant, which saves us a tremendous amount of money because our crews have been waiting around for hours and hours and hours for concrete, and then they end up having to work overtime or in the heat of the day. So
That was so smart.
yeah, it's a really versatile piece of equipment. It can also be used with snowplow. It can also work as a dumpster, like you can pull a regular dumpster box on
I
it. So
really got excited about the truck.
it's a great piece of equipment.
So you get to get a ride on it.
Maybe.
Are you done?
That
I'm
was a
done.
real question, wasn't
I
it?
had a couple of questions.
Sure.
So the first question was, obviously nothing happened with the traffic calming report. Traffic calming report?
Nope.
Okay. And you guys remember I submitted a bunch of specific asks, when we were doing the comp plan, like no left turn sign at 13th and Wilbert and Corbett, and reducing the speed limit throughout the city by 5 miles per hour everywhere, except in 20 mile per hour zones. Has any of that come up at Public Works?
No, and that's not part of the draft traffic calming.
No, I know. I had finished with that and I was moving on to this. So none of that has come up. Okay, and then my third is, I don't know if you guys could do anything on the fly. It's already after 8 o'clock, but could the Public Works Committee perhaps next month talk to us about how they furthered the transportation portion of the council goals in the, just,
Yes.
yeah, I don't want anybody to start jumping up with surprise questions.
Okay. Thank you.
Yeah. Okay.
All righty.
Thank you all for serving.
Yeah.
And next, Audit Committee Chair Anna Mockler is going to give us a brief summary of the last Audit Committee meeting. It's yesterday.
It was just, it seems like yesterday too. Actually, it was Monday.
Oh, it was Monday. Yeah,
Oh,
it wasn't
I got the
yesterday.
date wrong, sorry.
So, Auditor Sims is still working on the plan to compare what we're spending with consultants on communications versus would it be cheaper for us to just hire a communications manager? This is not like a push to hire a communications manager, whether it's affordable or not, it appears, right? So that was the intent back in January or February. So she's still working on it. She is going to she's presented it to a number of people at Public Works and DCD and done a bunch of comparables, and she is going to do a final run through to bring it back to the DCD director, Ned Lever and Katie Ketterer, I believe, but certainly the new Public Works director, and then bring it back to the audit committee next month. We then began to review the work plan. We reviewed the work plan extensively, and I thought that the community members were really good. And Jennifer, you were really good too, but they went right
Thank
past looking at procurement policies to make sure that we were avoiding, it's not corruption exactly, but it's like kind of, oh, I know this person would be perfect for this contract,
Conflicts of
or
interest.
sole source, which can put us in a bind, and Marwan was very passionate about that. And yet they chose, to my great pleasure, looking at the forest watershed, just historically, like, based on what we've been doing since about 2008, 2010, which is 25 acres a year, with all of the, I don't know a better word for ancillary, with all of the associated costs.
The profitability of it.
No, the associated costs, like, there's a lot of money spent on noxious weed removal, which those specific noxious weeds you wouldn't have if you didn't clear cut. right?
Yeah.
Scott's broom doesn't grow in the forest. Strengthening roads so that they can carry massive logging trucks. And how does this work out versus the salary of the forester and the forestry intern? And I think there's somebody else who does half-time. Just, like, how is this working out? What kind of profit? And the auditor there was a little discussion about that. What kind of profit are we making? Just
Is
to,
it paying for itself?
Right.
is it paying for itself, or are we
And
in
what are
fact making a profit? Cami Applebeck told us years ago that they projected to make around 120 or 150,000 a year on this. So it's just something that the audit committee really wanted to do. I thought procurement was interesting too, but they went with that. And then we're gonna meet next month. That's it.
Okay. Is there any council member who attended a regional or other committee or board
BFIP.
since the last study session?
Parks, Finance,
Yes.
Investment.
Pardon? Oh, I'm sorry.
Okay.
What happened?
I forgot.
Skip
I
me.
didn't. I
The
skipped it.
coolest one.
That's right. That's the PFIP, the biggest actor.
Parks, Finance, Investment and
Yeah.
Parking Committee Chair Jeff
Yeah.
Coughlin is going to give us a summary of the last meeting, which was held yesterday.
Yeah, that was a meaty one. We covered some of it today already. I think most of our time was on the in-park contract extension, which for clarification, I'm looking Director Riley.
Oh, sorry, what was that?
I just want to clarify. So I don't believe, from me looking at past notes, I know there was the meeting in there I missed. The full contract did not come to committee, Briar, right?
Linda said it did come through. I don't know what level of how deep we went into it.
Right, okay, yeah. I
So
think
it was probably pretty like it was renewal with.
Right, I think it might have been mentioned, I just want to clarify, it's not like the full text of what ended up on the council agenda last
No,
week, yeah. Didn't come from the committee, so, just to clarify that, so the
It did come yesterday.
But yesterday we did, yeah, so yesterday we reviewed it in full, so thanks for, having the full thing go through committee. So I think what was nice is we dived a bit into the contract itself. We clarified that although there's regular enforcement Monday through Saturday, for downtown core and other areas, there is still random Sunday enforcement. Because one of the questions I had was, and then there was a small, I'm gonna call it an error, just better wording that will be fixed for the contract to make that clear that there is random Sunday enforcement in residential areas in downtown and elsewhere. Eric brought up good questions about the pay by phone app versus phone versus registers. And
Michael, not Eric.
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 Holy cow.
Whoa, Eric's so big, he's like the Wizard of Oz right now here. Normally he is that.
Two people
Michael brought up, yeah.
with giant intellectual prowess.
I
know it's mentioned, man.
Yeah.
Behind the curtain.
Oh, goodness. So
Michael brought up.
the folks from InPark were there as well to answer all these questions. So
Okay.
basically, how are we making sure we're using the latest technology, that it's clear, that signage is consistent?
It works.
Right, that's working, if problems are happening, how to report it, so that was great. We dived a bit into, why this exact level, right? If we had more people, would that be paid for with extra, fines? If we had less, right, how much are we spending? And so,
More people,
let's say
Staff.
more staff, yeah.
okay.
So we are paying InPark a certain amount, and I'll look over, Mike, jump in anytime, I guess.
So you're thinking,
We're paying InPark a certain amount to do enforcement, right? And that's because we want to make sure.
so if there's more staff, there's more enforcement,
and
meaning
so-
more revenue.
Right, and yeah, or vice versa. Maybe we're not making our money back, or it's too much. Like, how do we know we have the right level? So we talked a bit at that. I would say there has not been a like super detailed analysis on setting that exactly, but the discussion was that we could in the future, we could easily amend the contract to add, say, like an extra half-time position for residential enforcement, or that was one suggestion, that having a dedicated half-time staff member for residential areas might be helpful, because we're getting increasing complaints.
What is not a residential area?
As opposed to like downtown core or business district.
Or East Bremerton? Is not a residential district?
No,
No? Okay.
I don't understand
There's a special, that was my objection to the import contract, was that it called out East Bremerton, and I couldn't understand why.
Because it had been added, it wasn't included.
Oh, right.
Yeah, and, Melinda explained that it was because there were so many parks, which doesn't.
Which then that's,
Well, in one.
I wasn't
part
at
of
that
East
study
Bremerton
session.
It is.
and that's when Denise called my name, but I wasn't even there to defend my Park Ridge district. But yeah.
Evergreen District, the Park Ridge. Evergreen Park has, a lot of edge, you know, so you could imagine that somebody would want to be doing a particular prowl there, but is Evergreen considered downtown core?
I don't believe so. No, I think
Yeah.
let's just stop. the
By
state
zoning
downtown.
it is.
No,
No, yeah, they changed it because, they
Is the
changed the
shadow ban
limits because there was certain things they couldn't enforce when people were parking in the bike lane on
Oh, and-
Washington.
in
So
the
now-
park contract, sorry, yeah,
So now it
Zoning.
has been,
exactly.
So,
Anyway,
Did they-
so
I'm
Go
sorry, after you.
oh, no, finish here.
So was there any explanation of why, like, they were doing random patrols or complaint driven?
Complaint driven, yeah.
Right, so, you know, either one of those, but East Bremerton gets its own special. And I was wondering about that because I have so many constituents who complain about cars parked on their street for weeks, if not months. And it, on my block, well, never mind, I'm not complaining about my block.
I did ask Melinda to put something on the website because Park can only go through like 8 stages of getting a vehicle
Yeah, yeah, yeah.
towed, you know, when people
Yeah.
are parked forever, and then it gets turned over to the police department.
No, I remember. I
So,
remember you asked, and thank you. And
So-
she said
so hopefully that goes up pretty soon, so people understand that more.
no, I think,
I
I
know.
thought that was a great question, and she said that they had flyers, which I really want to get my hands on. But, so was there any explanation of why East Bremerton is singled out?
So Melinda wrote back to your specific comment
Oh, good.
somewhere in there, I believe. I'm trying to pull that up for you.
Yeah, because I didn't get it.
I think it went to, let's see, maybe not. Jane, if you find it first, let me know.
I
Or I
haven't
can
figured
forward it
out the
later.
new email.
There
system
was,
yet.
anyway, yeah, man.
There is.
Move on and come
Let's
back.
move on and come back. I'll make sure I'll forward it to you personally if you didn't
Okay,
get it.
thanks.
But it was a response both back to my emails and questions I had asked and your questions as well. The gist though is that even though it's a 5-year contract, we can amend it to increase. We can easily amend it to increase the number of personnel and change it. So it provides some stability going forward, but it is still flexible. That was the gist of everything. And that there's a lot of other concerns about parking. One of the recommendations of parking studies have a parking committee. So we talked on that too, and to continue talking about how best to address some of the other parking related things that are outside of the in-park contract, but it was good to go through it all. All right, that,
You want my favorite part of the contract?
sure.
They can boot now.
Yes,
Oh, yes.
that is great.
Yeah.
What's that about?
Yeah.
Cause I thought they had the
Yeah, no, that was
ability to do
good.
it before.
That was a big change, yeah.
Yeah.
Any other parking and park questions? That'll come back, that'll be on the next study session, so we can also hash out.
Okay,
Study session, general, so it's back to the next slide.
great.
Yeah. Cool. We approved the court applying for a administrative office of the court grant. They're gonna give us the exact amount, it's probably around 15,000. There's only 267,000 for the state total. There's no match. Helps cover some costs. It's one we've got before, no other strings
Oh, I
attached.
remember that one.
Different one. So no strings attached.
Right,
Yeah.
No,
we remember that one.
no minimum salary. This is a different one. Yeah. And then
Totally different.
Similarly, stormwater capacity grant, 120K, no matched. They're going to focus on permit compliance. So we approved them applying for that as well. Kitsap Lake, Parks and Public Works are doing good work in the parking lot there. They're going to be coming to us with an amendment to the parametrics contract. There were some complications on the way the parking lot is draining. And so in addition to just other scope changes that need to happen. So it's going to require a larger budget, but because of the extra funds that they've received as part of that project, there's no budget adjustment. So they've already got extra funds, should be covered. That should be a fairly straightforward contract update coming to us. Pros plan, it's been going through Parks Commission. I think they're not tonight, tomorrow. Last night, thank you, last night, so they would have met. They've been going through all the components. That full draft should be coming to us in mid-September. And so it'll come to council. We can get more public comment on it and then looking to pass it by December. So should have lots of time for public comment. Openings on Parks Commission coming up, so spread the word, anyone looking at applying. And we talked about the HR director position. We talked about reclassing the budget manager. And the last thing was we went over July's finance reports, and June and July are now live on the website. So that's awesome. And I think things are looking mostly on track to the budget. So
Okay, good.
we're still, I mean, general fund, we're still spending more than we're taking in as per the past budget. But the projections, I'd say, are holding good. That's it. Finance is longer than public works, I think.
It's amazing.
It's rare.
It was a long finance.
Mhm.
Yeah. Okay.
So, couple of things. One was, wow, I really am getting tired. I had this.
It's dark out.
Mhm.
What?
It's dark out.
Yeah.
It is. It's
Summer
dark
is
out.
over. That's not fair.
One of the things that I thought Denise put it really well was when we got the mid-year budget adjustment in July. We had been hoping for like, here's some councilmanic, that was Eric's phrase, councilmanic decisions that we. can
Manic?
Matic.
I like
Councilmanic.
manic. I like manic.
I feel we should go with that one.
I like it.
Some various councilmanic decisions that we could make. And I also think I thought you guys did a really good job on that, because those are the kind of decisions the public will also be able to weigh in on. So I thought it was just genius all around. Did any of that come up at finance?
No.
Providing us with,
We briefly discussed, or this meeting or last meeting, the potential $20 car tab increase to go towards residential street funding.
the TBD?
Yeah.
It was very brief because it would be a conflict
Very
of a
brief, yeah.
quorum.
Right.
Discussed it
Like
fully at
mostly
two
public works we
committees.
went, yeah.
Yeah.
Yes, it would.
Or both, I forget. which
Perhaps
one.
we could bring it to the full council soon.
All right, we are.
Damn it.
And I believe that's the only
Yeah.
councilmatic one. The rest require. Yeah,
Voter.
right.
Better approval.
Oh, raising revenue?
You're talking about like
Yeah, yeah.
charter changes?
No, but there were other
No, but
councilmatic
putting it on the.
decisions. Yeah,
Putting it on the ballot.
Okay.
yeah, let's don't.
Yeah, I believe car tab fees are the only purely councilmatic option right now.
Well, we also.
Besides our usual,
We're the board of,
1% raises fees, yeah.
we're also the board of the water, wastewater and stormwater utilities, so
Yeah, all those, but talking general fund
we
funding.
could raise prices. I thought that was a joke. That was a joke. Sorry.
Careful.
I know, I
You're
know.
on here. Okay.
So other boards I thought that was a really long meeting.
It was a long meeting.
Yeah. Thank you.
When it has 8 words in it, the committee itself.
I know. I
You
really,
hear that screech?
I think we need to think about where, where parks really belongs.
Public safety at.
Well, that's where it used to be, but I don't
That's
see
where it
it.
used to be.
I don't see it.
I see it more as public works.
But you cannot fit it there. That's.
Yeah.
No, well, Public Works Committee meetings used to be 2 hours long. They're not 2 hour, well, they haven't been 2 hours long this summer.
So when they weren't on any official committee, they would just go where they needed.
Right, which was working. It was working.
This is nice though.
It was nice.
Like they have a connection though to the council, and this does give them that.
I don't think it needs
Yeah.
to change, just because you had one. I mean, you know what? It's time for another committee to start having 2 hour long
It
meetings.
wasn't even that long. I was
You
gonna
have
say.
time.
Yeah.
It was
Any
only
other-
45 minutes. So it wasn't 2
I have
hours.
a,
Right.
when it's time, I have a go to the quick, go to
We
the
got
order.
3.5 hour public works meeting.
I have a
so-
board,
Oh, board report.
Board.
couple of
I'm already bored. No, please,
So
just
Anna,
kidding.
I believe you've been to a couple board meetings.
Yeah, and I'm gonna make you all very, very happy because since this is the first nonprofit board I've ever sat on, I still am not really sure about what is confidential and what is not confidential. So I'm gonna defer my report on the KCR board until 2 weeks from now.
Okay.
I do want to bring up the training that I took at Jurassic Parliament, if that's okay right now.
Mhm.
All right, so just boiling the whole thing down, it was on taking minutes and it was all about action minutes. And one reason I wanted to take, I'm not gonna go into it. One reason I wanted to take it is that we often say things, and since it doesn't make it into the minutes, and people are really reluctant to try to go dig back through study sessions and, it's like, I just wanted some way to just get it in the minutes so we could flip back through the pages. So at the end of it, I asked, when we were bringing up new items during good of the order, how do we make sure that gets in the minutes? And she was like, when you bring up new stuff, that has to be an agenda item. And I explained to her how Rule 4 works now, as opposed to how it used to work. Because it was changed on October 18th, 2023. Threw that in there for you, Michael. And I explained the whole procedure and said, that seems excessive. And I said, I agree. So I think there's a case to be made for just bringing back the old Rule 4 in which you could just bring something up and go, do we want to talk about this at a future study session? Yes, no, okay, move it right along. The other thing that she said, in case you guys don't want to do that, and here I hope you'll adopt this, is when we come to a consensus, right, like we often do, and we all go, okay, we really want to do that, we have to turn to Anne and say, please put that on the record. That's it. That's it.
I'd say any of us should ask the chair of the meeting to make sure that, to sum up the action,
I
right?
don't,
Yeah.
however you want to swing it.
The chair should summarize and say, all right, this is the decision of the council. At that point, if anyone disagrees with that, that's the time to appeal and say, I don't think that's right. Or yeah, that's not how I heard it.
Whatever. I know that the majority of this council likes a strong executive, so whatever procedure it is, it's like,
What?
whether it goes through the chair or not, it's just if we say, please enter this into the minutes or please put it on the record, then we have it and then we don't get like weirdnesses. That's it.
Can I make a point just briefly about that, which is you know what, I'm gonna save it because I think I have 2 general business items, but they'll be so brief.
Okay.
Go to the order, sorry. Too brief. Very brief.
Okay.
Are we okay?
Number 1.
Okay, number 1, is there any interest, I mean, I think that having study sessions for 30 days available to the public without having some kind of public records request, maybe there's a way that we would explore having more availability of, because isn't it?
What? I
That's
don't understand what you mean.
Or the how long are the study sessions up for, on our website, under media, which doesn't
Oh.
make sense?
I don't know. How many days?
And then you got to make a special request.
Right.
Yeah.
I'm wondering if there's any interest to have more of, I don't know why they're not more available.
Might be server space. It's server.
Okay. I said it was gonna be brief, so I'm gonna honor that. I'm gonna give us another 60 seconds and then I'm gonna move on because we're tired and it's dark. So server space, would it be, like what about 60 or 120 days?
Council would request, I'll take a look at it.
I think longer, great. I did, as YouTube.
45.
There's
What?
limited space on YouTube.
Why can't we have them on YouTube?
Either city YouTube or BCAT, I would agree.
What about city YouTube?
I go to the Conduit. He films all of them.
That's true, but I mean, not everybody's, we're not, our job is not to defer people to an outside agency.
Yes.
Right, so our resources, could we put them on our YouTube and have it be in perpetuity?
how we do that, obviously our council meetings are not.
Yes.
YouTube being on Facebook
This
Live.
is where the good stuff.
This meeting is only through Zoom, we don't utilize the same technology, we use the same channel, so that's, yeah. So I would
Okay.
say we need
And
to-
it's only since COVID that we recorded video.
Well,
I mean,
I
It's
sound-
relatively new.
is there enough, interest
Yeah.
in discussing this at a further study session?
Yeah.
Sure.
Okay. And then the other one, that I have is, I just wanted to check in because I know that there's some interest around this, Navy dry dock situation. And as there was interest, you went to the meeting and Jeff, this is in your district. Is it somewhat in your district? I can't remember.
Mhm.
Okay, so.
Never been allowed in there, but. yeah,
Somebody wants to move it to my district.
So,
I'm gonna do this. Mine,
stop it,
mine.
this is my time.
Go ahead.
So I wanted to check in about our noise ordinance, and I believe I already know the answer, which is that we can't enforce our noise ordinance on the shipyard, but can we?
Not on the shipyard.
Not on the.
They can do whatever the frick they want, noise wise, and if they're a federal agency, we don't have any.
Well, they're not inside city of Bremerton, are they?
Nope.
Yeah.
Well, they're federal, like,
Well, I'm just going with the
Yes, yes.
simplest.
Okay, so the answer that I'm getting from the city attorney is we cannot direct the federal government to follow a city ordinance.
although weirdly, Jane and I are.
Sorry,
the
assistant city attorney, apologies.
council.
And so, the reason I asked this is because the noise ordinance is cited in that long document that they're putting out, that the Navy is putting out about this dry dock situation. And so just the fact that they're mentioning, which is perhaps a courtesy, but it's not something that they have to follow, but they're mentioning it in their EIS study. Anyway, about the noise ordinance of Port Orchard and City of Bremerton, but, I just want to check in on that and get because we're going to be dealing, I think, with repercussions for this issue over the years to come, but we have 15 years until it really comes to fruition. Is that right?
No, it's gonna take them 14 years to build it.
That's what I mean.
The first couple of years will be the most noise heavy.
Will be construction
biggest.
noise.
Yeah.
Everybody received.
It's gonna take them over 10 years of them driving down our poorly constructed Burwell Avenue. Well, not poorly constructed, but not meant for that type of vehicle.
Do we have any plan to perhaps seek reimbursement or any?
So, I'm sorry.
Don't
There
make me laugh.
are-
It's a serious issue. It's a water bottle. No, it's just water. No, but I mean, I think it would be nice to positively collaborate on this. What were you gonna say, Jeff?
Yes, and I have heard that there are, so I was talking to Katie Pratt the other day, who has expertise in historic,
About the building?
preservation and
Building?
remediation, yeah. And so my understanding is there are federal funds that are required for projects of this nature to go back to the local community. And it sounds like that's a discussion between
Just based on the history.
city and community and Navy, yeah.
Okay.
So I don't know all the details. I
Like a
think
mitigation.
absolutely, I would love to get the full details and what the process looks like for the city to negotiate or the community to negotiate. But my understanding is, yeah, federal funds do need to come back into the community, specifically for historic properties that are being removed, but possibly other.
So you're speaking, like, in this context, the historical property being removed is a shop, right? The shop
Yep.
building? And we have no interest in procuring it.
We could have
At least
another
not from-
museum.
We could have another museum for $1 and then move the lines. But that's not anything we want to put on the table. But there is the opportunity, perhaps, if the community desires it, to have more mitigation, more public hearings of some sort based on the historic building removal.
No, my understanding is
They have to.
that when
I
federal
know.
projects have impacts that impact historic properties,
Okay.
that by law, it's required federal funds go back into those communities to offset that loss of historic property.
It does make
Okay.
me wonder though if that would apply to a historic property that they own.
Right.
Like it'd be one thing if they're moving the fence line and they're moving into the city of Bremerton, which I'm sure they've done, and there's a historic building there.
Exactly.
But when it's already their building.
Yeah.
So I mean,
Right.
I support this every way.
I thought
They're
that-
exempt from a lot of things,
I'll look
I
at
thought
it.
that
even their own.
The 2 points, did everybody receive that email? I think the person's name was John Lane, John something. It was an email that took, there was a glitch while Christine was on vacation and it took 2 weeks to get to us. Anyhow, in this, it had a bunch of photographs of here's the street and here's where the work will be at the end. Okay. So 2 points were made in that were really good. One was that if they had to do alternatives 3, the dredging alternative, that the impact would be to Bremerton, but they were proposing to mitigate out in Kitsap, and that we should definitely say if the impacts. to
Mitigating
Bremerton,
Kitsap.
Mitigate in Bremerton.
They would spread out the
Yeah.
mitigation through Kitsap instead of just.
But
Yeah. And the
why,
second,
why for number 3? Because they're dredging?
Because
that's the only thing they would have to mitigate for.
it's Kitsap, because it's
Well,
probably,
then why are they proposing to put in a parking garage?
I can't say. but
Number
the-
3.
The other point that was made very often that I thought was really great was security from like people who had worked at the shipyard or been in the Navy and how very insecure they would feel working so close to the ferry terminal. And I
I've
think
heard that a lot.
that's, and I think that's a point that, is A, true, and B, might change their minds to, because having read it and looked through it, I wish I had gone to that meeting. And I support alternatives.
It actually wasn't a meeting, it was stationed.
Yeah.
And you're able to kind of go through, so
Yeah.
it was kind of nice that you were able to kind of ask your own things, and it was a little more one-on-one.
Yeah.
There was no presentation or. big
Right,
thing.
except people can't hear other people's concerns. So, I mean, there's good and bad about.
Yeah,
the
I
two.
wasn't implying good or
Yeah,
bad,
yeah,
it was just, it was not a meeting.
Yeah. Yeah, they,
it was like an open house.
yeah.
Yeah, is that the one that, you went to, Mark Williams? You went to as well, thank you, yeah. Okay,
But yeah, everybody has till September 3rd to put the written comments in.
okay.
Yeah.
Get them all there.
And will you make another announcement about that at our next?
Yes.
It'll be,
Ah, that'll be on September 3rd.
yeah,
Is
so
there
you have
time?
until 11:59, I think, Eastern Standard
Can
Time.
we make another announcement?
Make sure to make another announcement if it's not.
Oh,
announced
my.
yet.
That's
That meeting.
Oh, well.
Anyway, good thing to bring up, but I think absolutely what would be nice at some point, I don't know if either getting a representative of the Navy here, whether it's Director Herbig or someone from chain of command, I don't know, at some point
So Anne has been trying to make arrangements for the community outreach person. Is that,
Yeah, we're in the process of trying to set something up with both Jennifer and her name's Anna, who works for
Oh,
KSM.
fantastic.
Right, so there's,
Works for the shipyard.
not me, you guys.
Yeah, that'd be good.
Yeah, we're in the process. We've been trying for.
Quite a while.
It's
Oh,
difficult
fantastic.
To get on their schedule, but.
So
Yeah.
I think that they'll be at KRCC on Tuesday. I usually end up sitting next to her. So should I mean, yeah, okay.
reach out to the others.
Tuesday, yeah, you'll have it.
Super
before-
Tuesday, I'll have more
24
than
hours.
24. I'll have 36 hours but I'll make my real, no, but I'll see if, I can so maybe I'll just connect with you on what you're communicating with them and I can like,
Nice.
Try.
I had a very nice coffee with her the other week too. which is
Okay.
excellent. Yeah.
all right, so why didn't you bring up getting on the schedule? No, I'm just kidding.
Okay, are we done?
Okay. Sorry. Thank you for the conversation. That's it.
And then if there's financial impacts for finance or legal at some point, I don't know,
Mm,
a briefing or something
you
to
mean,
address what you're bringing up, what might be coming back to the city or community as a result of the project.
right.
In terms of direct funds.
It doesn't seem like we have a centralized, connection.
Response.
with
We don't,
Navy.
we don't seem to have that anymore, although my wondering is if administration has a better connection than we do.
Right, and so administration could brief on
Let's
their
hope so.
knowledge of it.
Yeah.
Okay, that's it. Thank you. for
Okay,
your time,
anybody else have
Kathleen.
anything for good of the order?
Mm-mm.
Okay, reminder, please RSVP by this Friday if you're gonna attend the city employee picnic on September 10th. There'll be a cornhole tournament. And a bake-off
Don't look at
Also,
me.
the new school superintendent is gonna be hosting 3 meet and greet opportunities on September 11th, 17th, and the 22nd at various locations. And I can remind you about that. Oh, and if anybody is able to go to the PSRC Regional Transportation Planning Community
going.
Meeting, Thursday, October 30th, I'll be in Mexico.
I've
so
already
I'm not going.
registered,
Okay.
Jen.
Okay, well, I
I'm
want
the
to see if
Kitsap
other,
Transit alternate.
well, I want to see if other people want to go.
Yeah,
It's a
no, I'm
community
just
meeting.
giving you that info.
Okay.
Should be up.
And
I
a
wanna-
reminder that your slides have to be in by noon on Tuesday.
Tuesday or Wednesday?
Tuesday.
That's new protocol, which is difficult. Here's what I'd like to say about that. I sometimes do my tours on Wednesdays of things. So,
It's too late for IT to do that.
yeah, well, sending pictures used to be
Well,
easier.
especially if there's a problem, then.
I get it, but I think that I was put off by a different
You guys wanna-
presentation.
Hold on a minute. A reminder that the next council meeting will be on Wednesday, September 3rd, starting at 5:30, first floor meeting chambers of the Norm Dix Government Center. Public is invited to attend in person or remotely, but anyone wishing to speak during public recognition via Zoom must submit their request through the city clerk by calling 360-473-5323 at least 24 hours prior to the meeting.